Apologize for the slightly late start this afternoon, and welcome to the Major Newt Hall of the Combermere School for the fourth, I'm enjoying myself so much it seems, the fourth in our series of town hall meetings on the COVID-19 vaccination and testing here in Barbados. I'm Brian Rees, and I will be your moderator this evening. The town hall format has been provided for all Barbadians to have an opportunity to engage with senior members of the government from various ministries, the labor movement, and the private sector, all of whom we will be introducing to you very shortly. However, we would wish to ask you to kindly stand at this time for the playing of the national anthem of Barbados. Ladies and gentlemen, as many of you have previously heard, this meeting was agreed to by the Social Partnership of Barbados and has been established to provide all of us with an opportunity for discussion and collaboration on the matter of vaccinations and testing. It is an opportunity for us as citizens of Barbados to share our suggestions and ideas, and I would even say further afield. The diaspora and others are watching as we carry on this discussion, and they too are participating this evening as well. We've assembled this evening again a number of subject matter experts to share their knowledge and experiences and to guide our collaboration. We will be led this afternoon and evening by the Prime Minister of Barbados, the Honourable Santia Bradshaw MP, along with, on our panel this afternoon, the Honourable Wilfred Abrams MP, Attorney General, Dr. Kenneth George, Chief Medical Officer, Dr. Ingrid Cumberbatch, Senior Medical Officer of Health, Dr. Natasha Sobers, Senior Lecturer in Epidemiology at the University of the West Indies. And in our audience this afternoon, we have Dr. Clyde Cave, Consultant Pediatrician, Mr. Ronald Chapman, Director of the COVID-19 Unit, Dr. Elizabeth Ferdinand, Co-Coordinator of the COVID-19 Vaccine Program. We also have Mr. Edward Clark, President of the Private Sector Organization of Barbados. We have as well from the Ministry of Labor, the Chief Labor Officer, Mrs. Claudette Hope Greenidge, Mr. Wayne Sobers, our Deputy Chief Labor Officer, and also Mrs. Alison Elcock, Senior Safety and Health Officer. So we again have quite a number of persons to engage with you, to collaborate with you, and hopefully to provide or to guide us as we generate those suggestions and ideas that will redound to the benefit of all Barbadians. We will commence this evening with a presentation by our Prime Minister, the Honourable Santia Bradshaw, who I'll ask to make her presentation right now.
Thank you, Chairman. Pleasant good evening to each and every one of you, both the online viewers and certainly those who are here physically with us in our presence. This is the last of the consultations, as Brian is saying, there have been so many thus far, and I think we've been so enjoying ourselves that we don't want them to end. But the truth of the matter is that we are here because of the discussions at the social partnership meeting. We're here because I think this is a true example of participatory democracy at work. It is an example of us giving people the opportunity to express their concerns, their fears, to be educated as well, and certainly for them to educate from their standpoint how they feel about the issues of vaccination and testing. But this debate has perhaps over the last few weeks been also about choice and the rights of people to choose whether they want to be vaccinated, whether they want to be tested, and the rules that will surround all of these issues. The good thing about the past few weeks, though, is that we've had the opportunity to be respectful of each other. And while I know at some points tempers may tend to rise a bit, I can say that, and I can speak for both Minister Abrams and myself, we're both pleased with the way in which Barbadians have behaved. While there has been protests, while there have been strong opinions expressed at these meetings, I think for the most part we have been respectful of the views of each other, and I would want to think that long will that continue. It is the reason why Barbados has been often, as Dr. Williams described, as a developed country. We have always set certain standards for ourselves, and not only in our behavior, but certainly in our outlook. And we have not necessarily behaved as a developing country. And I've seen borne out over the course of the past few weeks the ability of our people to express themselves in a way and that shows the passion for the subject, but they're still willing to appreciate that we may not always agree. And I think that is what is important. As I was coming here this evening, I received a report from the Bahamas of one of the hospitals there, the Princess Margaret Hospital, where the hospital is on the brink of collapse. The doctors and nurses are struggling because obviously the number of cases have spiked in their country. And I can only pray for my sisters and brothers, certainly in the region, who are facing this at this point in time, and who, in many cases, the vaccinations would not have reached them in a timely manner. And I know that we're going to do all that we can to make sure that we support our brothers and sisters across the region. Fortunately, we've had the receipt of vaccines last week, and I'm told by the CMO that we will start the rollout of the Pfizer vaccine from tomorrow. Again, those who are interested in taking it will take it. Those who are not interested will not take it. But that is the freedom of choice that has been given to all of us, and I just want to say long may that continue. I have had the distinct pleasure, along with my colleague, Minister Abrams, of being able to lead these consultations. And while I have, I've certainly learned a lot in these forums, and I'm glad that we've had the opportunity as well to have such distinguished men and women across our medical profession being able to speak with such authority on these issues. I don't think sometimes we realize how fortunate as a country we are to have produced outstanding men and women who can speak with such authority. And for that, Barbados should be eternally grateful. I want this evening that you appreciate as well that we have taken into account the various views that have been expressed, the various questions that have been expressed as well in the various social media platforms. We recognize that there were certain trends that were appearing to end without being able to let people know that we have, in fact, identified common trends in their questions and being able to give them answers to those questions. So this evening we will take that opportunity, as it's the last one, to be able to allow those persons to, those questions rather, to come forward, certainly to the medical team, so that they can pose their various questions. So again, it's the final consultation. As you can appreciate, after this, we go back to the social partnership for our meetings to discuss all of the issues that have been raised here, all of the various views, and we will continue to communicate with the general public. The Prime Minister will return tomorrow officially, although I believe she has been working behind the scenes despite being on vacation. But she will continue, no doubt, to lead us through this process as well. So that's it from me. Brian, again, I hope that our deliberations are fruitful this evening.
Thank you very much, Prime Minister. Before we continue, I'd wish to recognize the presence of the Minister of Labour and Social Partnership Relations, the Honourable Colin Jordan MP, and also at the head table, seated at the head table, Dr. Linda Williams, the President of the Barbados Association of Medical Practitioners. Ladies and gentlemen, in the previous sessions, due to the time constraints that we've had, as our Prime Minister has said, we've been unable to accommodate all of the many online viewers and also the questions posed on the Facebook, the YouTube channel, and also the government's information services channel, I'm sorry. There's so many of them. We really have had a large number of persons who are interested in participating. And this evening, we want to make sure that we provide those persons, especially with this opportunity, to participate. So as we did in our last meeting, we will be starting this evening's session with a series of questions from our online audience before we then transition to our face-to-face audience here in the Major Newt Hall. I'm again asking you to please be considerate to those persons who want to participate, especially those who want to participate for the first time. We would ask you to allow those persons who are here for the first time to have the opportunity to approach the microphone in these early stages of the discussion. We also ask that you limit your presentations to 1 point per person, as we do have many persons interested. I would also ask that you try to limit it to a 2 to 3 minute period of presentation. We want to hear from you, but we also want to hear from as many people as possible. So let's all be understanding of the need to involve and engage, as we are a population of people who are very interested. For the protection and safety of all persons here in the hall, I will ask that at any one point in time, only 2 persons should be standing to approach the microphone, and we would ask that those persons remain at least 6 feet apart. While you're seated, we would ask as well that you maintain your mask, or maintain the mask on your face, so as to ensure that, again, we do everything in our power to protect ourselves from the COVID virus. We know the transmission is very easy, and we therefore need to put all of our efforts forward to protect ourselves. When you approach the microphone again as well, we would ask that you please accommodate us by stating your name and then proceed with your presentation. Therefore, again, this afternoon or into evening, ladies and gentlemen, the question being asked of you is, what are your thoughts on the COVID-19 vaccination and testing? The floor is open to the comments, first of all, from our online audience, and I'll share them for you. First of all, there is a question from Alyssa Noellen on the Barbados Government Information Services Facebook page. The question is, when can appointments be made for the Pfizer vaccine?
So good afternoon, everyone. The Pfizer vaccine, as you know, is in Barbados, and we start our rollout tomorrow. It's going to be a limited rollout. We are doing some individuals like recruits from the Barbados Defense Force and other small groups as a trial run. Then later next week, we will proceed to the general population with a view to shortly, once the Ministry of Education is happy and we go through a few steps, to invite younger individuals to have their vaccines that are approved in persons 12 years and older. So that is the rollout. We will continue to work with you with respect to this. You can register for vaccinations online, and there is a choice. So currently the choices are Sinopharm, Pfizer, and once we have AstraZeneca, that choice will be available to you. So we are offering Barbadians a choice. You can either say any, or you can choose your individual vaccine that you see fit. Thank you.
Thank you, Dr. George. As a follow-up to that, I know many Barbadians hear of these different vaccines that are available across the world. One of them specifically that I've had a lot of persons ask about was the vaccine being produced in Cuba. Can you share any insight into that vaccine and whether Barbados has any interest or capacity to be able to get a hold of it?
Certainly, the answer to that question is yes. We have indicated that vaccines should be WHO approved and SAGE approved. SAGE is a group of specialists that come together and make determinations on vaccines. They examine the evidence and they put a position forward based on their scientific teams. And once the Cuban vaccine has gone through that rigorous process, Barbados will certainly be willing to look favorably at vaccines coming out of Cuba. Thank you.
Thanks again. A further question from Corinthia Dupuis. I'm not sure of the pronunciation here, and I apologize if I've totally destroyed your name, ma'am. But the question is the website for reporting adverse effects available to the public?
So that is correct. It's called there is adverse events following immunization. And this is a team consisting of persons such as the CMO, Dr. Elizabeth Ferdinand. The president of BAMP is on that team. We have persons from whose discipline is in pharmacology and pharmacovigilance. And that team meets every week and carefully scrutinizes the side effects, and with a view to trying to see if there is any indeed link to any vaccine that is given. So I just would like to assure the public that that is what we do. I don't know if Linda will like to add any extra with respect to the AEFI committee.
Right. Dr. Cave, if I can bring you into the conversation. A question is being asked here by Dr. Williams. Dr. Williams, I'm not sure if your mic is on.
Right, thank you. The AEFI team meets weekly or bi-weekly, and we review all of the reported cases. If you go to the Barbados Drug Service website, there is a part of it where you can find the adverse effects in immunization, and you can report both from the patients and from doctors. So there's 2 different places that you can make a report, that the doctor can either report it or you can report it. And each of those reactions, each one is dealt with in turn. And if we need to get further information, then we contact the persons.
What we can do, since this has come up a couple of times, is we can put that information out on JS tomorrow, advising exactly how you can report any adverse effects of the vaccine. So Sheena, just ensure that goes out tomorrow on the JS platforms.
Sorry, can everyone, that's better. Dr. Cave, a question has come from Wayne Gooding, and the question, first of all, very politely starts off, good afternoon all. I would appreciate if I can have a question answered. Are there any known effects of either the COVID-19 virus or the COVID-19 vaccination from a pregnant mother to an unborn child?
Good afternoon. Yes, there has been a lot of concern about this. Vulnerable people, newborns, children, pregnant women, among the most studied people before they are given approval for a vaccine to be used. The number of cases where it has been proven to be transmitted COVID virus from mother to child, as opposed to catching the virus after birth, are extremely, extremely small. We're talking about single digits where this has been. So for all intents and purposes, there is no transmission from mother to child. However, it is an infectious virus, so there is the possibility after birth that an infected mother can transmit to a child. This is, however, so small, as we have learned from experience where COVID-positive mothers have had children, that initially we would separate them, but it was found that rooming in with the mother and child in the same room, continuing breastfeeding with only a mask worn during that interaction, has not resulted in a conversion of those babies to any kind of symptomatic disease. So while it is theoretically possible, the practical answer is no, this does not seem to happen, and we're very lucky that that seems to be the situation.
Thank you very much, Dr. Cave. As a follow-up to that, Andrew Murray asks, according to the CDC, and he states a statistic, children have a 99.998%, his statistic, recovery rate from COVID. What is the need to vaccinate them with an experimental vaccine?
There are several aspects to that, and that is certainly one of the reasons why children were not on the very first group of people being vaccinated. Even though children, we know, can have complications of COVID and can be ill, it is true that they are very, very unlikely to become significantly ill. The jury is still out as to whether they can be mildly ill and have long-term or long COVID diseases. So that is a relative unknown. We know at the moment that that is possible. We just don't know how much. Children would have a vaccine both for their protection and for the protection of the society. And we know that even though children may not themselves be very ill, they can be vectors and bring home the disease to vulnerable people within their household. And that has been a concern. So that's the balance. The first thing is do no harm. And I think our experience now, certainly with the Pfizer vaccine, is that it is safe for children whose immune systems have matured, usually around the age of puberty. That's why we're using 12 and beyond. There are ongoing studies in younger children whose immune systems are less mature. The work is to decide on the dose. There have been no signals that it is unsafe or there are bad side effects.
Great.
So while the child themselves, if you were to balance the risk, would have a very small chance, the risk to the society and the family is what you would consider.
Great. Thank you so much for that response, Dr. Cave. I think now we can switch to, and I'm sure most of you have seen a presentation previously by the Ministry of Health, but we do have a number of persons in our audience who are here for the first time, and I know online we also have a number of persons. And at this point in time, I would like to ask Dr. Ingrid Cumberbatch, Senior Medical Officer of Health, if she would be willing to provide the presentation on the COVID-19 virus.
Thank you very much, moderator. Good evening, Barbados. It certainly is a pleasure to be here. And I just want to say, let's talk. As the moderator would have said, the material in the presentation being used at today's session has been seen before and will be familiar to most of you. I will, however, take this opportunity to re-emphasize and highlight what I consider to be some key points. Let's start with the daily dashboard for Barbados. I know that this dashboard does not satisfy the needs and desires of some of you. However, the aim is for the dashboard to provide at a glance basic information on the COVID-19 situation in Barbados. This dashboard, as featured, is released today, and it reflects that as yesterday, August 17th, there had been a total of 4,594 cases diagnosed and 48 deaths since the beginning of the epidemic in Barbados. Some global statistics are reflected in the blue section at the bottom of the dashboard for comparison. And specific to the day of August 17th, there were 13 new cases from 1,381 tests done, with 127 persons reported to be in isolation. The dashboard also records the number of vaccine doses given, both first and second doses, and the percentage of the population that is fully vaccinated. A call was made at the last town hall meeting for a daily explanation of the dashboard, but I would like to recommend that the implementation of a weekly or other routinely timed epidemiological report may be more informative and useful to those desirous of obtaining more in-depth information of the local situation. Such a report can be used to provide highlight trends and even provide projections. This is currently under consideration by the Ministry of Health and Wellness. By now, most of you have heard about the 7-day average and certainly the positivity rate. Even though you may not be able to understand the fine details that are used to calculate these two graphs, you can see that something significant happened in January this year, peaked in mid-February, and then started declining again in March and April. We know that this is when the Alpha variant started to circulate in our community, and we had a surge in cases resulting in our highest wave of the pandemic thus far. If you look at the positivity rate at the peak of the graph in February, it reached almost 12%. What did that mean for Barbados, and what were some of the lessons identified? We do not exist in a vacuum, nor in a bubble. We are not exempt. Impacts that are seen around the world from COVID-19 may have a delay or lag time, but expect and prepare for these impacts. Know that the same way that COVID-19 has challenged and in some instances overwhelmed healthcare systems around the world, for example, USA and Italy, our healthcare system has also been challenged and certainly can become overwhelmed. Full lockdown with strict measures in place, negative impacts on mental health, negative impacts on the NCDs and other routine healthcare services, negative impacts on our economy and fiscal health. The 5% threshold for the positivity rate is used as a guide with respect to what measures should be implemented or relaxed, with a higher rate suggesting acceleration of measures and a lower rate the reverse, an easing of measures. Currently, our positivity rate is less than 1%, and at that rate, we have seen an ease in restrictions. What we have achieved currently has been the result of a lot of hard work from testing, contact tracing, and innovative interventions, such as having a designated isolation facility and hotel quarantining of primary contacts. We want our positivity rate to remain as low as possible. I want to take this opportunity to implore the public to be cooperative to the fullest extent with the contact tracers and not to be abusive, evasive in the information requested, tell lies, provide deliberate misinformation, nor hide from the contact tracers. We are in this battle together, and we should be our brother's keeper, but in the right way. It is possible for us to become overwhelmed. There's a thin line between maintaining and being unable to maintain. What we saw before was all related to the Alpha variant. We've been told consistently that the Delta variant can cause disease more easily and affect many more people than any other variant identified thus far, including causing infection in some fully vaccinated persons. Conservative projections show that with an outbreak of Delta variant, we would have at least 5 times more cases daily than we saw with the Alpha variant. That is 500 cases daily. The sheer number of people needing care would present a significant strain to an already stretched system. Look around us, see what is happening what happened in India and the impact of the Delta variant on that country. The many persons who were ill and the many that were so ill and requiring oxygen, such that oxygen became scarce and a precious commodity, resulting in healthcare workers having to make hard choices as to who should have oxygen and likely have a better outcome. Look closer to home at our neighbors in the region who are experiencing increasing cases of numbers of daily cases, whose healthcare systems are either at capacity or have become overwhelmed. Look at the increasing numbers of children who are being ill and requiring hospitalization and ICU care due to severity of illness. This is the situation all around us. Do not think that we are exempt. Our system has the potential to be overwhelmed by sheer numbers in daily cases, numbers of persons with serious illness, and those requiring ICU care, and number of deaths. We don't want to reach the point where tough medical choices need to be made on an individual or community level. And we are hoping in these meetings to be able to convey the real possibilities that this could occur. COVID disease has the potential to affect everyone in this country, regardless of age, race, or gender. And I'm sure that many of you, over the course of our epidemic, have taken note of the babies, infants, and children who have been positive with COVID-19. Once we fully understand the threat, we can see why we would want everyone to be aware of all preventative measures we have at our disposal. Everyone is at risk of exposure and could have negative outcomes if they become infected. I want to take you all back in history with the information on this slide. Many of you may have heard of the threat, heard of the Spanish flu. Some of us would have experienced SARS. Most of us experienced H1N1, and all of us now are experiencing COVID-19. I put it to you that for H1N1 for sure, all of this information was the same for persons at risk and risk factors. COVID-19 may be a new disease, but it has similarities to other diseases that we have fought in the distant past and more recent past. And their principles and technologies which are available and on which we can build to fight COVID-19. So what can we do to stay safe? We all know the mantra. We know the program. Wash your hands, wear your mask, and wear them properly, and stay far. We know it, so we need to do it. But there are other important things that we also need to do. Eat a balanced diet, exercise routinely, increase our vitamin C and other supplements, herbal or medical, to keep our immune systems in good working order. With the exception of measures related to restriction of movement prior to early February before the arrival of the vaccines, this is all we could do. These are all part of the layers of protection to reduce the risk of getting COVID-19. Since February 8th, 2021, we've also been able to add another layer, and that layer is vaccination. This graphic demonstrates a multi-pronged approach to protecting ourselves and others from contracting the disease called COVID. This is the Swiss cheese diagram. That's what I like to call it. As you can see, like Swiss cheese, each layer on its own has holes. But as the graphic clearly demonstrates, the more layers you have or use, the more likely you are to be successful at preventing the spread of infection. We can't get away from that. If we want to do appropriate prevention, we need to put all the layers in place. So let's talk a bit about vaccines and the vaccines available for COVID-19 currently. This slide provides examples of the various types of vaccines that exist and the type of immune response that may result from the specific vaccine given. An important point that needs to be made here is that although we are now almost 2 years into this pandemic, the SARS-CoV-2 virus is still a new virus, one that for the majority of us, our immune systems would not have seen before. By vaccination, one of the main things we're trying to achieve is to help our immune systems to deflect and fight off COVID-19 diseases. Vaccination serves as an additional layer of protection against COVID-19. The purpose of taking a vaccine in the first place, any vaccine, is to allow your body to mount an immune response to the pathogen being introduced, to give your immune system a heads up, so to speak. The benefit of this is that an immune response is mounted. This means that when your body becomes exposed to the pathogen again, illness is either prevented or the severity of illness is reduced. There are several different types of vaccines. Each type is designated to teach your immune system how to fight off germs and the serious diseases they cause. The majority of vaccines used against COVID-19 are what are called next-generation vaccines. They're either mRNA vaccines or viral vector vaccines. Now, when it comes to immune response mounted, you will note that the slide refers right at the end where you see the Pfizer, Moderna, and the AstraZeneca. You would note that the slide refers to an ongoing evaluation of the immune response. Yes, the effectiveness and response mounted is still being looked at. Nobody denies that. But the evidence that is already available shows that response is occurring in those who have received a COVID-19 vaccine, and that response has been beneficial. A question was posed at the last town hall meeting about the ingredients in a vaccine, and I really appreciated the comparison that was made with the lemonade. Because if I was asked that question at that point in time, I can tell you I wouldn't be able to answer it as I can answer it now, because some of these questions need a bit of research. So I'm going to tell you the ingredients in the 3 vaccines that we have here available in Barbados, which is the Sinopharm, the Pfizer, and the AstraZeneca. And I'm going to use the same analogy that the person who posed the question asked. So in Pfizer, mRNA is the only active ingredient and uses this technology to build antibodies against COVID-19. That's the lime or the lemonade. Lime or the lemon. Sorry? Well, when you have your turn to ask your question, you can ask me. But let me make my presentation. Thank you. The mRNA contains the material that provides instructions for our body on how to make the COVID-19 spike protein that triggers an immune response within our bodies. Lipids, or fats, which are needed to deliver the mRNA to the cells, are one of the non-active ingredients. Salts, which are used to help balance the acidity in the body. Sugar, which is basic table sugar. Sucrose, which is used to help the molecules to maintain their shape during freezing. Those are the basic ingredients in the vaccine. AstraZeneca. The active ingredient is a weakened adenovirus, and that is a virus that can cause bronchitis, but it's a weakened form of it. That's what we know it can cause, which gives the body instructions to create the COVID-19 spike protein in its cells. That way, when a person is exposed to COVID-19, the immune system will recognize the part of the virus that has those spike proteins and will know how to fight it. This is the same way or same type of technology that the flu vaccine used, which is the viral vector technology. And it's a pretty old technology because it's developed and in use for about 40 years now. It's a proven, safe, and relatively old approach. Non-active ingredients such as ethanol, which is used as a preservative, sugar as a stabilizer, and emulsifiers to ensure that the components stay together during the transportation and storage process. That is basically what's in the AstraZeneca. To answer one of the questions previously raised as if the spike protein is toxic, there's currently no scientific proof to support that spike proteins are toxic. Sinopharm. The active ingredient is inactivated SARS-CoV-2 virus particles that have been grown in culture in a laboratory and then were inactivated to lose disease-producing capacity while still stimulating an immune response. Aluminum oxide is used as an adjuvant, and this just means that it helps the inactivated SARS-CoV-2 virus to stimulate an immune response. The non-active ingredients are salt, sodium dihydrogen phosphate, and disodium hydrogen phosphate. Some of the benefits that have been documented with respect to the administration of COVID-19 vaccines include the fact that there is reduced infection, reduced transmission, and reduced severity of disease. We must also remember that our population demographics put us at an increased risk and vulnerability due to a high burden of NCDs and the fact that our population is very elderly. We have an aging population. And as I have emphasized continuously, we don't wish for our healthcare system to become overwhelmed. Again, vaccination is another layer in our preventive measures that may help us to avoid this. Data from the isolation facility at Harrison Point has shown that the proportion of those admitted to Harrison Point with COVID-19 who was unvaccinated is very high in comparison to those admitted who have been previously vaccinated. 84% of persons admitted this year have not been vaccinated, and the percentage of those fully vaccinated who have had breakthrough infection is low, only 7%. This information is not currently being presented to the public routinely, but this is presently under consideration within the ministry, and if done, we will seek to present information in a simple and impactful way, similar to the example which will be shown in the next slide. I assure you that the Ministry of Health and Wellness is listening to the concerns, comments, and questions raised by the members of the public, and we are reviewing and seeking to appropriately address the issues and answer your questions. We welcome your feedback, because we are in this together. So this is the dashboard from the Bahamas. Everybody can see the impact of this dashboard. Though our presentation is not as visually impactful as this one, when you compare the information presented from Barbados and from the Bahamas, a very similar pattern is seen, where 97% of persons hospitalized were not vaccinated, 3% were partially vaccinated. It speaks for itself. This slide, this is about choice. Your choice to take a vaccine, your choice of which vaccine to take, your choice not to take a vaccine. All choices are sound choices once you understand and fully explore the consequences of your choices and are willing to accept those consequences. That's the important point. All choices are sound once you do all of those things and know that choices come with consequences. As we all know, the vaccination program in Barbados began in February of this year with the administration of AstraZeneca vaccines. As of August 17th, just over 100,000 persons have received a first dose, and 87,096 have also received a second dose, ensuring that 32.1% of the population is fully vaccinated. a request has been made for a comprehensive explanation on herd immunity. Herd immunity, or population immunity, occurs when a large portion of the community, that's what we call the herd, becomes immune to disease, making the spread of disease from person to person unlikely. As a result, the whole community becomes protected, not just those who are immune. And I'm going to give you a little practical example using the persons at the head table as my population. So I am the virus, the new virus that has never been infected by anybody, but never been exposed to. I like the virus, right? Yeah. So the moderator, he was out vetting, and I went and I infected him. And next to me, Dr. Sobers Granum, I also infected her. But persons in the community became aware that this virus is circulating. And a vaccine was developed. So Minister Abrams and PM decided that they were going to get vaccinated. But Linda and Dr. George, they didn't make up their mind yet about if they're going to get vaccinated or not. But because the moderator and Natasha had infection already, they developed natural immunity. The Minister Abrams and the PM, because they were vaccinated, they got immunity from their vaccination. So what happened is that Linda and Dr. George, who are part of that community, have become protected because you have immunity in the population from the ones who have the natural immunity and from the ones who have been vaccinated. Some of you may ask, right, why is it that we don't let natural immunity run its course? Because when we have diseases like this one, we're seeing that a significant number of persons are being ill and a lot of severe illness and death. That is unconscionable. We can't do that. That is not the first line of defense at all. So if we have preventive measures such as washing your hands, making sure you wear your mask appropriately, stay social distancing or physical distancing, and now the vaccine, that is the things that we're going to put into place or want to put into place so that we can achieve this population immunity. Often a percentage of the population must be capable of getting disease in order for the disease to spread. This is called a threshold proportion. If the proportion of the population that is immune to disease is greater than the threshold, the spread of disease will decline. And what percentage of a community needs to be immune in order to achieve population immunity? It varies from disease to disease. For example, for measles, that's around 94 to 95%. But with COVID-19, the estimates from around the world are around 70% or greater. And that's estimates because we're knowing that we are still learning about this disease. So 70% is what most persons are working with at this point in time or greater. This slide is a reminder that we do have vaccines available so that we can continue and escalate our efforts to increase the percentage of the population that is fully vaccinated. Vaccines have been sourced from various places and through a variety of mechanisms. Most recently, just over 70,000 Pfizer doses arrived last week, and additional arrivals are expected. Your choice, Barbados. Get vaxxed. In summary, COVID-19 continues to present a significant threat to all of us in Barbados. All members of the population have a role to play in taking action against this threat and having the awareness that there's a real possibility that we as a health system, as a country, can become overwhelmed. Protection comes from layers of various measures, such as adequate hand hygiene, appropriate wearing of masks, and physical distancing to help to reduce spread. Vaccination against COVID-19 has an important role to play in reducing the risk of serious negative outcomes, such as serious disease and death, and provides another layer of protection. Ladies and gentlemen, thank you for your attention. I will now hand over to the moderator to facilitate the remainder of the session. Thank you.
Dr. Cumberbatch, I want to thank you for bringing the information to life for us like that. And unfortunately, the reward for good work is more work. Some questions I'd like to pose to you. Coming from Miranda Douglas online, Miranda asks, "Good evening, I have a question. From the data provided, all or most of the persons that died from COVID in Barbados had a compromised immune system or an NCD. Shouldn't the MOH, the Ministry of Health's main focus be on educating the public on preventing NCDs and good healthy practices?" Thank you, ladies and gentlemen. One moment.
That is an excellent question. Remember what I said to you about preventive measures? And that preventive measures was not only mask wearing, washing your hands and physical distancing, but you had to put other things in place, such as having your diet correct, using a balanced diet, improving your immune system through either herbal or medicinal ways, getting good exercise. It also means that if you have an NCD, you also need to be taking your medication, and many of you would know that part of the management of NCDs calls for persons to do lifestyle modifications or changes, and that includes the same diet, the same exercise, the same taking your medication. And what is about? Yes, the Ministry of Health will continue to educate, because we haven't stopped. We will continue to educate. But what we also need are for persons to take responsibility for their diseases. And that means that you are not, we give you the medication, but we can't make you take it. We tell you to exercise, but we can't make you exercise. So I'm saying to you that it's a two-way street. We provide the information, we guide you as to the correct things you're supposed to do, but you still have to do it. It is still part of your responsibility.
Thank you, Dr. Cumberbatch, I'm sorry. Any other panelists wish to weigh in on that? Dr. Williams, it looks like you're interested.
Thank you for the question. The question was about if all the people who died had NCDs, should we not focus on that? And of course, in our population, we always want to focus on NCD management and care. However, I want to point out something. I realized that a lot of emphasis was placed on people having NCDs, especially in the first part of this pandemic. The pandemic has changed. As variants came into the space, what has been noticed worldwide is that younger and younger people with no prior history of NCDs, people with no underlying risk factors, were getting sick and very sick. Also, we had children who were getting very mild cases of COVID, who were then developing multi-system inflammatory syndrome of children, or the so-called MIS-C. And of course, these children did not have NCDs. With Delta variant, what we see now is that the largest number of young people and children and previously healthy people with no underlying risk factors are also at risk of getting a very large infection and their bodies being overwhelmed, and they also are at risk of hospitalization and death. So the pandemic has changed. It's not just old people, elderly people, people with NCDs who are getting hospitalized, who are being at risk, but also younger and younger people are being admitted. Now, if you are older, of course, and you have an underlying condition, your risk of demise is greater than a younger person. But the younger person may still be hospitalized, they may still be on oxygen. There are many factors influencing recovery rate. And I don't think that any of you would want to go through that experience of having to go through ICU care, high flow oxygen, and maybe even intubation in order to reach recovery. And that is what is happening all over the world. So I want you to get away from thinking that this is a disease that only affects people who have underlying conditions. It is not. None of us have encountered SARS-CoV-2 before, and the reason why it's a global pandemic is because everyone has the risk of becoming infected. Everyone has the risk of getting this disease. It doesn't mean that you will not survive, but you are all at risk. So I just want to emphasize that having an NCD doesn't give you greater risk of getting the disease, but it may give you a poorer outcome if you get it. You do not need to have an NCD to have a poor outcome. Thank you.
I make
Thank you,
a
Dr.
comment
Rose.
also.
Sure, CMO.
There's another link to NCDs. As you may know, if our healthcare system becomes overwhelmed, and let's say that 80% of our admissions to 90% of our admissions, in some countries, there are no ICU beds. And the challenge is that persons with NCDs will be crowded out in a pandemic. So that the persons with NCDs have a double whammy. They are certainly at increased risk for poorer outcomes, but even if they can't come to hospital and get full access, the QEH has sounded the alarm with respect to persons with NCDs presenting later and presenting in more difficult situations. And the reason this will become more stark when we start to have a high burden on our healthcare system that only tries to accommodate the COVID patient. In Barbados, we need to be multi-pronged. We need to address the NCD issue, and we need to address the COVID issue at the same time. They are linked together as one. Thank you.
Thank you, CMO. Coming out of the presentation as well, another question is, I'm sorry, PM?
I just want to jump in here because I think there's another perspective, and I think the person who may have asked the question may also be going in this direction. The fact that in this crisis, we have, in a sense, not been able to focus on NCDs as we would like. And we've not been able to focus on it because the attention has been on the COVID-19 pandemic. The reality is that when we sit in our subcommittee meetings, we talk sometimes about people who required surgeries and were not able to get the surgeries in time. We talk about people who are immunocompromised, they're undergoing cancer treatment, and their appointments have been postponed because of all of the different technical issues with the hospital and having to take precautions to keep our doctors and our nurses safe. So I think we all get it that NCDs are supposed to be the focus of the Ministry of Health and Wellness. Nobody's disputing that. And where we may not have been able to address all of the things in the past, the truth is that right now we know what we have to do, but we also have to fight this virus first and foremost, because that is what is going to compromise the ability of children to get care, is going to compromise the ability of elderly people waiting for surgical procedures to take place or eye surgery operations to take place. All of this is being compromised because of an inability to be able to get people either vaccinated or to get people to do the right thing to protect each other. So I just want to say I understand where I think the underlying concern is, that maybe we don't focus enough as a country on all the other things. But right now, what is facing us is telling us that we have to focus on those things, but we also have to face what is in front of us, and that is this pandemic.
Thank you very much, Prime Minister. One final question before we move to our face-to-face audience and to our medical team again. The question is asked by Mona Robinson, and she asks, unfortunately, there are people who cannot take the vaccine but are very vulnerable. How do we protect those persons?
Thanks for that question. That comes back to the whole process of what I spoke about herd immunity and population immunity, where, yes, there are persons who may not be able to take a vaccine for whatever reason, but because there are enough persons in the population who have been vaccinated or have developed immunity to the disease, they extend protection to that person who's unable to take the vaccine. And that is the example that I was giving when I spoke about Linda and Dr. George not taking vaccine, and the other persons who would have developed immunity and they being protected because of the level of the immunity in the population. Because in order for a disease to spread, you need to have vulnerable agents or persons for it to spread to. But if they don't have enough of those persons, then it can't spread. So that is basically what happens.
Thank you
And
very
how they're
much, Dr.
protected.
Cumberbatch. Thank you. Ladies and gentlemen, we will now move to our face-to-face audience. Again, I'd like to invite one person at a time, or two persons. We have two microphones, two persons only. Can I have the first person who would wish to pose a question to the panel, or also those persons who have suggestions and ideas to share with the panelists?
Good evening.
Hi, good evening.
As a person with nerve injury, I had a torn brachial plexus, and I have chronic nerve pain. As a result, I may have to visit the hospital on occasion. Now, I know that in order to go to the hospital, you have to be COVID tested. But we have seen outbreaks at those institutions. So common sense tells me that staff may probably be bringing in the virus. I don't think that's fair. And as a result, I think that certain categories of workers should really consider being vaccinated against this virus. What steps are being taken to make sure that is done?
Thank you very much for your question. CMO?
So, as a matter of policy, what the Ministry of Health did was, at the rollout of this process, we invited and encouraged persons who work in healthcare institutions. They went to the top of the line. We went to every institution in Barbados and had campaigns within those institutions to make sure that individuals who work on premises of healthcare institutions were vaccinated. Why? Because their clientele tended to be older, either have mental illness, either have NCDs. The truth of the matter is that the response has been mixed. We have had successes in public health. We're up to 78% of our nursing staff have been vaccinated. In the psychiatric hospital, it's a bit less. It's about 68% of the nursing staff. So we will continue to use moral suasion and to use whatever tools are available to make sure that persons who take care of individuals in institutions are vaccinated. That is just good policy. It doesn't make any sense that you are in a sick bed and the person who is taking care of you is not vaccinated. Ideally, that should not be the case. We don't want an individual who is in hospital to end up with something they didn't go into hospital with in the first place. We have this mantra we say in medicine, do no harm. And the issue with respect to vaccines is an added layer to protect vulnerable persons in vulnerable situations. Thank you.
Thank you very much, CMO. Sir?
Yes, hi, good afternoon to all in the panel and all here today. I heard...
Sir, would you mind just sharing your name so we...
Antonio Franklin.
Thank you.
Yeah, I heard earlier someone was making mention on the panel about the ingredients that are in the Pfizer BioNTech vaccine. Now, if it is, you go on the BioNTech website, you will see that the vaccine contains something called lipid nanoparticles. Could you please educate us on what those are, if it is those are safe, how long those stay in the human body, and if it is, they can be removed?
So those compounds are deemed to be inert, and they're lipid because to interact, the first interaction, you need lipids to move through the system. So they are like carriers. It is not an active product within the vaccine.
I just want to add to that is within the lipid nanoparticles, the mRNA is contained, which is why you have to keep those vaccines at very cold temperatures. But our bodies are composed of lipids, including our cell membranes. So in order to transport the mRNA to where it needs to be in a layer that is soluble, that can enter the cell. The body is made up of lipids which are similar to the lipids used in the vaccine, and so they are not harmful in any way to the body.
Thanks, Dr. Williams. Sorry, Mr. Clark, before you go on, I just want to mention to everyone that we do have Dr. Corey Ford online, and he is available to answer any questions. You may remember Dr. Corey Ford is an infectious disease prevention specialist.
Good evening. My name is Ronald Clark. It's a blessing, it's a privilege and an honor to be here. Special thanks to the Acting Prime Minister, to the Attorney General, President of the medical professionals and the CMO, and all of those in the audience here this evening. I wish to express my disappointment at the 3 events so far, because from what I understand, this was supposed to focus on mandatory vaccine and testing, mandatory testing, particularly coming out of comments and concerns which spoke to the mandatory testing and vaccination of employees. I appreciate the medical brilliance and eloquence of all of those who've put forth their submissions, and what this essentially has been to date, until tonight, is a stand-home clinic, as opposed to an exercise in dealing with the crux of the matter that was raised. So I express my disappointment in the unavailability of that opinion. But I'm sure we'll get the opportunity to talk about that very soon. I'll focus on that and acknowledge the work that the medical professionals are doing. Medical professionals are being medical professionals. Politicians are being politicians. I am not vaccinated. I will not be taking a COVID-19 vaccine. My children are not vaccinated. My children, 4 of them, over 18 years of age, 28, 23, 21, 19, and 12 years of age. My father went to school here. I went to school here. My 12-year-old is going to school here. I will not be giving permission for her to be taking a COVID-19 vaccine. I don't have much time, so I won't talk about MMR and all of those things. I'll look at this situation here. Last week, while watching, Minister Abrams corrected a statement he made earlier at one of the sessions relative to recourse and liability. And when I heard him initially, I said, well, that's not entirely correct. I'm sure that if it's indicated to him, he will make the correction, and he made the correction. By the way, I have no political axe to grind. I voted for the BLP in 2018, 2013, 2003, 1999, 1994. Therefore, you'll see that the majority of my support politically has been for the Barbados Labour Party, but I am not a member. And neither as an unvaccinated person am I a second-class citizen of this country. The issue with the presentation so far, and understandably so, is that they go in one direction, as if unvaccinated people don't exist, except to be told, get the vaccine. We work, we contribute, we produce, we create. We are intelligent, even if we choose not to take the vaccine. We are responsible, even if we choose not to take the vaccine. So this talk about us being a threat to vaccinated persons is unfortunate. And that's the social climate in which we are operating today. And there are those who are hopeful that a decision can be made to invade my body without my permission. That cannot work in Barbados. What was telling about the statement by the minister, which was a correct and true statement, is no fault, no liability means that if you take the vaccine, you are at risk. The same way that unvaccinated people are at risk. As far as I'm aware, no liability, no fault means if anything happens to you in the future, I'm not talking about the first jab, second jab, my arm sore, got a little headache, bellyache, diarrhea. I understand that in the first couple of months. But we're talking long term because there are unknowns. The doctors cannot tell you emphatically that nothing will happen. It's impossible for them and the manufacturers to say that. That is why the condition of no fault, no liability, no accountability and responsibility is sought before these vaccines are distributed to any country. But let me tell you something. Your risk may come at a cost. Your refusal to take a vaccine may come at a cost. But what's in it for the manufacturers? There are a couple of things that have not been brought to any of the national discussions on COVID-19 and vaccination. There is a business side. And if you want people to be informed about making their choices about whether to take a vaccine or not, and let me stress, I am pro-choice. If you want to take a vaccine, you take the vaccine. You have a right to make that choice. My sister's taking it, my brother's taking it, my best friend's taking it, my cousin's taking it. That's their choice. But let me tell you why it's interesting that all around the world, these vaccines are distributed. Pfizer, who we heard about tonight, says that its first half of the 2021 financial year sales was $7.8 billion in the last 3 months. So much so that Pfizer had to upgrade its annual forecast from $26 billion to $33.5 billion in vaccine revenue alone.
There you go.
Not right now. Not right now. This means, therefore, the forecast earnings on shares have gone from between $3.55 to $3.65 to $3.95 to $4.05 per share.
Sorry, Mr. Clark,
Yeah.
we need to ask you to
I'm going to say that.
consider
Okay.
it. All
Okay.
right?
So I'm making the point that there is a financial incentive, not for the government, but for the manufacturers. All of the risk and all of the liability for your entire lifetime will be at you. So employers may feel encouraged that if there's no fault on the part of the distributor and there's no fault on the part of the government for allowing access, well, maybe there's no responsibility on my part to demand or insist that workers be vaccinated. I say that is not the case, cannot be. And I'm sure that if it comes to that, there will be those who will make that clear. But let me just say this as I wrap up. There's so much to say, and perhaps if invited to another forum, government or otherwise, I can share that. I need the government to understand that we all want to see Barbados prosper and do well and heal. I'm not anti-vaccine, but I am pro-choice. And I believe that and there are many vaccinated persons who support the position of pro-choice. Do not give the impression that people who are vaccinated do not support the right for us to say no. The same way that I support the right for them to say yes. We must understand that there's a lot of money circulating amongst the unvaccinated population. Business owners need to understand that. Those who have products and services need to recognize the revenue that we generate and the money that we spend. Money that, if forced to, can circulate within that vast majority of the population who are not vaccinated. And let me make this point. I've already told you my political history. But I would like to hear the members of the government who are not comfortable with this possibility, this discussion or thought of mandatory vaccination, to speak out. To speak out and show that all the revolutionary fire that you've shown before, all of the passion that you've shown for the predominantly black working class of these people before, that you stand up when the time comes and represent them once and for all. And finally, you should know that a vote against a politician is more dangerous and impactful than a big rock.
Mr. Clark, I want to thank you for your perspective, but I also recognize that on the last occasion you may not have heard the discourse that took place, because I had to correct on that occasion others who tried to convey the impression that this discussion was only about us coming to say something about mandatory vaccination. I want to make it clear to you, coming out of the social partnership meeting, the issue of mandatory vaccination was put on the table. It was part of a wider discussion. As a consequence, we felt we needed to come to the people, allow people like yourself to express how you feel about the whole concept of a mandatory vaccine. The fact that the medical professionals have taken the time to come here to speak about vaccination is not for us to pronounce on anything at the end of these consultations. It has always been and will continue to be for us to listen to you. So I understand your narrative of support for the Barbados Labour Party, for the government. That is fine. This is not a political discussion. It is also about you doing exactly what you did, expressing your views. I just want to also indicate, as I said before, the Prime Minister is back tomorrow. But she intends to speak to the country, not just on the issue of the mandatory vaccines and all that has happened coming out of the consultation, but on a number of other issues as well, sir.
I just wish to say to that, with all due respect, one of the reasons why there's this thing that people categorize as vaccine hesitancy, and the consistent mention of mandatory vaccination, in spite of what you said before, is that there is a lack of trust. There's a distrust based upon the consistent one-sided position of medical professionals who care about lives and politicians who have other issues to consider. There's a level of distrust among the community that these meetings and constantly telling people to get vaccinated will not fix.
You want to go again? Thank you very much for your well-articulated position, Mr. Clark, sir.
Hello, hi, good afternoon. First of all, let me just introduce myself. I'm Dr. Vidya Armagan. I'm an orthodontist here in Barbados, and I'm president of the Barbados Dental Association. I appreciate having the town hall meetings. I think it's been a phenomenal effort on the part of the government, and I think it's brought a lot of issues to light. I understand the gentleman's concern that we have not perhaps addressed solely part of what this town hall meeting was to do, but I do feel that it has educated the public in a way that has been phenomenal. Addressing what the gentleman did say, I did come here to present a way forward. There's a 4-step approach in having a plan on how we go forward. As you see, there's going to be a lot of resistance to mandatory vaccinations, and we understand that, and it is a right of every citizen. And I don't think any of us has a problem with that. Our way around that is to educate, and that's what the medical community is trying to do, is educate. Because if you're ignorant, and I don't mean that in a bad way, if you don't know something, you have to be educated to understand it, to make an informed decision. And I think that's what we're trying to do, is ask you to make an informed decision on vaccination. On the way forward, I would suggest that let's get those people that want to get vaccinated, vaccinated. That's priority 1. Let's move mountains to do that. If that means Pfizer, we have it now, get it here, get it out. If some people want Moderna, let's find out. If they want Johnson & Johnson one jab, let's find out, move mountains and get it here. Let's get our population numbers up. So at least the people that want to get vaccinated can do so. I think that's the first step in this process. The second step for a small island developing country like ourselves, which actually, to me personally, makes no sense, is that we should have a national contact tracing app. Barbadians and West Indians are a funny people. If we line up for a flight in Toronto airport, it's a nice straight line. There's no bickering, there's no fighting, there's no pushing, and there's no shoving. When you see the line at what used to be BB down here, it's a whole different story, and it's the same people. But that's us as Caribbean people. We tend to be passionate, and when allowed to, we're rule breakers. One of the things that I've noticed in going around Barbados is there's not a lot of people that are maintaining the registers. So we've asked people to maintain a contact tracing register at their offices, and they're not doing that. The people that are doing that, we could tell you, there are people putting down fake names and people putting down fake numbers. So when it's time to track them, you can't find them. And certainly if we have a population with 32% vaccination, we need to find those people. And a national contact tracing app is going to do that. Singapore has an amazing app. We should get it. There are 2 local people that I am aware of that have developed an app locally. We need to get it out there. It is not about our rights and nobody needs to know where I go on a Saturday night or whatever. This is about finding out when you've been in contact with someone and you're potentially exposed, informing you, isolating you, and testing you so we can stop the spread of this disease. These are some of the things that are going to stop us from needing to do drastic things like mandatory vaccinations. The third thing may not be popular as a tourist island. One of the things that I think we failed at is looking at our tourism and our tourism product. We have excellent protocols in place right now. Negative PCR tests 72 hours before you arrive here. Vaccinated people have a certain protocol. Unvaxxed have a certain protocol. And you get a PCR test and you go straight to your hotel. One of the things that we should look at is when you go to that hotel, you stay at that hotel. Don't come and mix with us as Barbadians at this point in our history until we get our numbers up. At this point, come and enjoy Barbados, the sun, the surf, the sand, the hospitality at the hotel, but stay there. Stay at that all-inclusive resort and don't venture out into our society until we get our numbers up or we figure this thing out a little bit better. The hotels that choose to have tourists take only tourists. The hotels that choose not to have tourists can accommodate the locals, staycations, weddings, ceremonies, and things that we can now open up because we're not getting that penetration of the infection into our society. The people that want to join our society, it's very simple. Do your 2-week or your 6-day quarantine, have our national contact tracing app, and get tested. So at least we can follow you when you come out of that quarantine, and we know if in fact you do develop COVID. Because COVID has an incubation period, anywhere from 5 to 23 days. We know this. This is science. So let's take advantage of that. And let's look at our tourism product, redefine it slightly for this period of time. The fourth one is going to be a very unpopular one because I am going to suggest in moving forward that there are some professions that we need to look at very seriously for mandatory vaccination, healthcare being one of them, hospitality being one of them, teachers being one of them, and the disciplined forces being one of them. Now, I'm not suggesting that, the people that don't choose to have this vaccination but want to work in that field should be forced to be vaccinated. I'm saying that, this is a consultation, this is a process. We need to figure out what to do with these people. Do those teachers that don't want to get vaccinated stay home and do the online classes? And eventually, when we start vaccinating kids, are those the kids that stay home and do online courses? And the others come back to school? In a medical field, a lot of the people that come into our offices are compromised. We certainly don't want to be infecting them. They're already immunocompromised. And certainly we don't want our staff infected because we're seeing so many people. Certainly we don't want our hospitality industry to be welcoming people to Barbados and infecting them. It makes no sense. So I do think part of your process, unfortunately, is figuring out how we get the people that are working in these sectors vaccinated if they're dealing with the public. I applaud you. It's not an easy task you have, but good luck.
Thank you, Dr. Abergon. Is there any response from the panel on these suggestions? No? AG?
Vidya, I want to thank you for that. And from the beginning, what we kept pushing out was we're here to hear your concerns, we're here to hear your answer your queries, but we're also here to take suggestions and possible solutions. Because at the end of the day, whatever decision that is made or whatever policy that is implemented has to be one that is for the benefit of Barbados. It's the considered position of the government for the benefit of Barbados. So for that to happen, we have to let all opinions contend, have to let all ideas be ventilated. We have to listen very carefully. Then we have to go back and look at everything and figure out how with all of this can we come up with the best possible suggestion for Barbados. So I appreciate the fact that your intervention contained some active proposals for solutions, and I can assure you that we recorded all of this, and every day after these meetings we compile the questions, we compile the answers. We also look for solutions that can possibly be developed to the benefit of Barbados. I want to commend you on your presentation and thank you for it.
Thank you, Attorney General.
Good evening, everyone. My name is Michelle Edwards. I think I represent an ordinary citizen of Barbados, and I speak from my heart and not from my intellect. I do appreciate all the intellect that's in this room, I really do. But any one of us that can read can go on Google and WebMD and all these sites, and we can read all of this information ourselves. And whilst we don't all have a medical background and we don't all understand all of these terminologies that are being used, it's there out there for us. So basically, I just wanted to say that I've lived in Barbados all of my life, which is 64 years. There's nothing to hide. I have enjoyed the freedoms that have been available to me in Barbados. In religion, I've had free education. I have been able to vote for who I want to. I have been able to join societies as I please. And I hope to enjoy that until I die. And I hope to be able to leave that for my children and my grandchildren. I understand that this is a new virus that has attacked us, and it's come from wherever it's come from. And I do understand that there is a lot of necessity to take pro-action. However, I am a little concerned about the bombardment, really, and the fear factor that I have experienced on mostly every time I turn on the radio, the television, open the newspaper. Wherever I go, it is the fear factor. I do appreciate the presentation that was given this evening, but the way it was, the intonation, I am speaking from my heart. The intonation, the way that we speak with our eyes says more than and the way we make our facial is very frightening to a society. We have little children in homes where we sit and watch television and we hear this sort of thing, and children have to grow up and live in this world. We are leaving this world for them, and I understand that what my parents left the world for me. So I want to leave them a world like that. I don't want to leave them a world that's fearful. So I would like to suggest respectfully and humbly that some kind of consideration is given to presentation on, it is not all about facts and percentages and all of that. I think also those percentages and facts are hugely overquoted and over maybe one or two people or one or two children and those kind of things. I think if you're going to be specific, then you have to be very specific, but the fair factor. So my advice, my consideration today is about how it's presented. I would also like to say that we as a nation have only ever paid lip service to health and wellness of our citizens of this country. Lip service. We are all ready to jump on the bandwagon to spend millions on PCR testing and isolation and quarantine centers and all the rest of it. But over the years, we have spent very, very little on health and wellness. My colleague over there, she did say that, those things are encouraged, but the cost of things is out of this world to be healthy. The cost of eating healthy food is out of this world for the average person on this island. So paying more than lip service is necessary for us to have a healthy nation and have less NCDs and less of those unhealthy people. And not just giving them education. We are not just to give them a billboard education or the odd TV program on heart disease and all of that. It really has to be studied. And how are we going to do it?
Ma'am, we appreciate the effort you're putting into this, but thank you very much, ma'am.
The adverse effects. I came here with hardly any information about how one could make that available, that information made available to us. And basically, I think that Dr. Williams, you referred to the website, but it needs to be a little bit more user-friendly. And the doctors need to do the reporting and let the patients know that they can report it as well, because that is not known to us. It's not known to us. Okay. So more positivity is what I'm trying to say. More positivity. We live in a world that is ordered, our steps are ordered by God. We come under we are all His creations. COVID has not taken Him by surprise, and we sing our anthem very proudly. We stood for it today. And I still believe that we are under God, and God is in control of Barbados, and I do not want us to lose sight of that. Thank you.
Thank you very much, ma'am. Ladies and gentlemen, I just want to give you a heads up. I will be taking 2 more face-to-face presentations, and then we have to go back to the online forum. We have hundreds of persons there who are also trying to make their contributions as well. While we prepare for the next face-to-face presentation, I just wish to recognize the presence of the Honourable Kirk Humphrey, the Minister of Maritime Affairs and the Blue Economy.
Good evening to the panel. My name is Saitomi Worrell. I attended another meeting, but I was listening verbally on the radio. But I come here with a small question. I share the sentiments of that lady that just spoke, and I recognize, yes, we live in Barbados. Some of us are not even aware of what is going on around us medically, and we need to be educated, and I want to say congratulations and thank you to the panel for upgrading us from various time to time about what is going on. But my question is very small. I am speaking about those children that will not be vaccinated because their parents are adamant they are not being vaccinated. And you have to respect that because it's not mandatory, it's a choice. But what about those children that would be exposed in the schools? I am sure you cannot stop a child from playing. So how do we protect those children that would be vaccinated against the ones that would not be vaccinated? I would really like that question answered. Thank you.
Thank you, ma'am. Any responses from the medical staff on the panel?
I can start the ball rolling. First of all, let me say thank you, ma'am. Your question is a good one. What we're trying to achieve in Barbados is to protect everyone who is vulnerable and who cannot be vaccinated.
Sorry, Dr. Williams, my apologies. I think some persons are having trouble hearing you.
Sorry. Can you hear me now? Our goal in society is to try to protect those in society who cannot be vaccinated, whether they're children or very elderly or for whatever reason. We recognize that in societies where there are high vaccination rates, the virus has less ability to be transmitted between people who are vaccinated. And that means that even those who cannot be vaccinated will be protected. Now, in the concept which we were referring to before as herd immunity, we now know that for the Delta variant, that a large proportion of the society would have to be vaccinated in order for that to occur. So we're not really trying to achieve a specific number. You know, we're going to force it to whatever percent. We want to get as many people vaccinated for that community protection as possible, so that those children, if there are vaccinated children around them, they have a lower chance of interacting with the virus. Now, I just want to say, in response to the things that were said before, that we appreciate everyone's concerns. And one of the words that I think was unfortunate in the midst of this crisis is that mandatory makes it sound like someone is going to drag someone away and do something that violates their will or violates their body. Hold on. No one is violating your will or violating your body. What we're doing is presenting the options to you.
Sorry, Dr. Williams, one moment, please. Ladies and gentlemen, we have always maintained a level of respect for the speakers while they're making their presentations. I would ask us to continue to do so. I unfortunately also have to ask those persons who are standing behind the gentleman in the blue to return to your seats. Remember that we are trying to maintain a level of social distancing to protect ourselves, and unfortunately, we will only be taking this last question after Dr. Williams has finished before we go to the online audience. Dr. Williams, my apologies for breaking you.
Thank you. The only one who has the power to make something mandatory is the government. The only one who has the right, we're in a health pandemic, to make something mandatory is the government. That is why we're having the consultation and the discussion, because no one else can insist or enforce that right in a free society. And that's why government is listening, and that's why we are listening. We recommend, as Dr. Armagan had suggested, we recommend that all healthcare workers, because of what the gentleman said before, should have vaccination in order to interact with the public. This is the precedent that occurs now. As doctors and as dentists and as healthcare professionals, we all had to receive vaccines in order to treat you. We had to get hepatitis vaccine, we had to get chickenpox vaccines if you didn't have chickenpox, you had to get a variety of vaccines, and you had to show that you had your childhood vaccine in order to practice medicine, dentistry, nursing, etc. There is a precedent for this. No one dragged us to get those vaccines. I could have gotten to the place where I said, I don't want to take these vaccines. But if I didn't take it, I wouldn't be protecting you when you come to me as a doctor. So I had a choice to make. Do I want to be a doctor? And do I want to protect those who come into my care? I chose to protect those who come into my care and to take the vaccines that were necessary for me to practice medicine. So although you say there's a mandate, the mandate was for me to make the choice that allowed me to do what I do safely. And that's what we are calling for in society, that those who have to make the choice to protect others be given the opportunity to make that choice with all the information available.
Thank you very much, Dr. Williams, sir.
Good evening, ladies and gentlemen. My name is Fred Corbin. I'm a professional race car engineer. I have a background in nuclear, biological, and chemical weapons study. And I also have civil engineering, aerospace engineering, and marine biology as correlated subjects of study. I came here this afternoon not only to represent the people of Barbados, but to bring a certain educational perspective to what a tremendous amount of people have been asking me, with the kind of background that I have, in understanding what is actually going on. So I have one question, which I don't want a response to. I don't really need a response to the question. And then I have a series of points I would like to back up that question with. And I'd like to address this question directly to the Chief Medical Officer and to my lady over there in the corner. I'd like to ask the Chief Medical Officer, please, to provide evidence for the public education that describes the isolation of a SARS-CoV-2 virus directly from a sample taken from a deceased patient, where the patient sample was not first combined with any other source of genetic material, i.e. monkey kidney cells, aka Vero cells, liver cancer cells.
Sir, before the CMO continues, I must remind you that you have to maintain a brief period of time for your presentation.
Sure.
We have many persons who still wish to participate.
I understand that, but you also have to realize I'm educating a lot of other people who are listening for this.
I appreciate
your situation.
We appreciate that as well, sir.
Right. That leads me to my next point.
Sir, we haven't heard from the CMOs yet, I believe. Well, he's refused.
So I am not, I'm really not clear, so.
Okay.
So you gotta either slow down or.
That's okay, that's no problem at all. I'll just move on. We got limited time.
No problem.
Addressing the situation where a lot of people believe that the SARS-CoV-2 is a novel coronavirus. SARS-CoV-2 is a subclade of the beta coronavirus family. And how do we know this? Simply because we did cross-referencing via the international taxonomy reviews and then correlated those with actual genetic sequences and reviewed them against the patent records that were available, and it is apparent that the declaration of a novel coronavirus is a fallacy. There are several coronavirus sequences that have been uploaded, but there was not one single identified novel coronavirus, none at all. Furthermore, patents on coronavirus sequences were sought as early as 1999. Up until 1999, patenting of coronavirus sequencing was uniquely isolated to veterinary science. First vaccine patent for coronavirus was sought by Pfizer, and more specifically, the patenting of the S-spike protein, the same thing we've allegedly only just discovered. First patent application was filed January 28, 2000, 21 years ago. There is nothing new about this. And in support of that, we have this document. This is the evidence supporting that. This is the evidence which shows that that SARS is no naturally evolved virus. It's not a naturally evolved virus. No one has ever produced a safe and effective vaccine against a coronavirus. It has never been done, and it never will be done, simply because it's not possible. Therefore, I go on and quote, the co-receptor dependent phagocytic general method of action, for those who don't understand that, okay, this is science talk, okay? I'm following the science now, so bear with me. General method of action for infectivity and pathogenicity, in other words, this is what makes it so deadly, okay, of SARS-CoV-2 appears to be specifically related to cumulative charge resulting from inserts placed on the surface of the spike receptor binding domain. What does that tell you? This is a lab-engineered phenomenon. And how do we know that? We can back up that simply because we have a document produced and very kindly submitted to us by our friends in the CCP Intelligence Service, who gave us this document where it says 2 mutations were critical for bat-to-human transmission of Middle East respiratory syndrome coronavirus. This is where AstraZeneca and some of the other vaccine manufacturers get their vector from. It's just that there's one small problem, is that it outlines direct collusion between the Communist Chinese Party and those who were building it. We recognized HKU4 spike, aiming to build its capacity to mediate viral entry into human cells. To this end, we introduced 2 single mutations. We introduced 2 single mutations, not they, we. S76R and S76A into HKU4 spike. The S76R mutation was expected to restore the HPC motif. I go on and quote further. We produced retroviruses pseudotyped with HKU4 spike, referred to as HKU4 pseudoviruses, in human cells.
Sir, I think I've given you a fair amount of time
I'm not
Sir,
done yet.
Sir, Mr. Corbyn, Mr. Corbyn.
I'm addressing the
Mr.
chief,
Corbyn.
I'm addressing the doctor over here.
Allow me to share with you one point.
Yeah.
We need you, as this is a town hall meeting where everyone wishes to participate,
I understand.
to come to a point where you give us a suggestion, an idea, or a proper question.
I just want to address the doctor in the corner.
What?
Thank you, Thank you, Madam Prime Minister. I appreciate your help. I just want to address my lady doctor in the corner. We're going to have a drink over this, by the way. When I challenged you with regard to your ingredients of the Pfizer vaccine, I had good reason to do so, because I hold in my hands an internal document from Pfizer Laboratories, which was given to us by a very special person who we have contact with, called Reverse Engineering the Source Code of the BioNTech Pfizer SARS-CoV-2 vaccine. And this is very, very critical, because it outlines the chemical and the biological processes which were very, very carefully manipulated in order to be able to produce an mRNA that also contained a very, very dangerous toxin to the human body. Do you know what that toxin is? That toxin is called graphene oxide. And every single one of these vaccines in a 30-milligram shot contains 15 billion nanoparticles or lipid carrier particles within the mRNA sequence. 15 billion nanoparticles. And let me tell you how graphene oxide works when it gets into the body. Because when the spike protein then binds itself to our blood cells and so on, graphene oxide then starts to build a structure. And this is why we have people with blood clots and we have people with heart failure, sudden heart failure, and so on, because the graphene oxide is building structure.
Mr. Corbyn,
Madam Prime
again.
Minister, may I go?
Mr. Corbyn, you're lecturing at the moment.
I'm not lecturing. I'm
you
just
are,
bringing the
Mr.
facts.
Corbyn.
I'm educating.
And we have...
I'm educating.
Ladies and gentlemen, Mr. Corbyn, we have... Ladies and gentlemen, can I have your attention? Mr. Corbyn, we have definitely now given you sufficient time to make your presentation. We have to give others a similar opportunity. And therefore, I have to ask you to please make a point, provide a question, or we will have to cut your microphone.
Okay. One last question.
As much as you have support in the audience, we have a number of persons who need to be heard as well. This is your final opportunity, Mr. Corbyn.
I appreciate that, sir. Thank you, Madam Prime Minister. I just want to make sure that everybody understands that Barbados is actually a signatory to the Convention on the Prohibition and Development and Production and Stockpiling of Bacteriological and Toxic Weapons. And we signed that treaty on the 16th of July, 1976. However, the patent databases that we have accessed proves that COVID-19 and COVID-19 vaccines are in fact a bioweapon. And how do we support that? Because we have a copy of the mysteriously deleted Wuhan databases that tell us everything. Thank you very much.
Thank you very much, Mr. Corbyn. Thank you, Mr. Corbyn. We will now be going to the online, sir. We will be going to the online group now. I'm sorry, is there Ms. CMO or? Oh, I'm sorry, Dr.
Yeah,
Sobers.
I just wanted to say a couple of things. Honestly, I haven't really said much because I really wanted to take the time to listen to what people were saying, and I really appreciated a lot of the comments, especially, you know, the lady who spoke from her heart. I always speak from my heart as well. And so I say that I speak from my heart when, and it's not just as a medical professional, I speak from my heart when I say that I want people to become or be pushed. I'm pushing the vaccination because it's hardwired in me to read the medical literature and see what the evidence says. It is hardwired in me. If I see that you are ill, we look at what is the best available evidence and apply that best available evidence. And so I speak from my heart when I say when I look at the evidence, even though the vaccine hesitancy was there, it is absolutely not true to say that there's no SARS coronavirus. So your beginning premise, Mr. You spoke before, but you're not, so I listened, right? So your beginning premise that there's no such thing, therefore, as SARS coronavirus. This is an absolutely incorrect premise. And then the second premise that you know the vaccine is not working. We have several clinical trials. We have real-world evidence that says persons who get this vaccine, 21,000 persons will get the vaccine, and 21,000 persons will get a placebo or salt and water. 11 persons from the 21,000 who got the vaccine will get an infection. So that is what we call breakthrough. And while 200 people who got the placebo will therefore will get the coronavirus, showing that in our studies that there is, showing in our studies that that there is absolutely showing in our studies that there's a decreased risk of catching the infection, that there's an increased risk of hospitalization, that there's a decreased risk of deaths. We have seen it. The figures that were shown to you about Princess Margaret, those were not created by Pfizer. Okay? I can tell you something about the pharma companies. Of course, you know, there's lots of mistrust with pharma companies because they like to make billions of dollars. That's what they do. Of course, we have mistrust for them. But here's the thing. If I have a cancer patient who needs a medication, you know what a big pharma does? They make that very, very expensive. But it doesn't mean that treatment doesn't work. That's their thing. Their thing is to make money. Our thing is to save lives. And so from my heart, we say our business is to save lives. Our business is to put the best available evidence out there, to read literature as best as we can. And I appreciate these town hall meetings, but I also think that it'd be interesting as next steps for us to have conversations, real life conversations. You know, really talking and saying, what are my fears? Because I hear about persons' fears about taking the vaccine, and they're very real, and I really appreciate that. And I will also say that my fear comes from looking at the stats and seeing the hospitals become overwhelmed and persons possibly dying. So I've shared my fears, and we really appreciate you sharing yours.
Thank you very much, Dr. Sobers. Dr. Sobers, I'm glad that you've joined the conversation at this point in time, because I actually have a question from you from Rochelle Harewood. The question is, would the virologist explain, and I hope that I am not overstepping your academic skills here, but would the virologist explain the term of gain of function and explain if the very rapid mutations seen in the genetic makeup of SARS-CoV-2 could be as a result of gain of function? If this is the case, how will the vaccines manage or outstrip the mutations, especially as new is being considered, or has been, and is number 13 in the Greek alphabet in 21 months? Is this normal or natural?
Yes, so you are absolutely overstepping my set step as a virologist, because I'm not a virologist, I'm an epidemiologist, and so I would not adequately be able to explain that gain of function. If one of the other panelists can, that would be great. I'm very happy to say that completely oversteps my boundary.
No
but
problem.
I also think that we can get back to the person on that question, so it's an excellent question. Mm-hmm. Mm-hmm.
Let's move on, ladies and gentlemen, to another point raised on the online platform. It's by Marjorie Bartlett Wall on Zoom. I believe we actually have answered this question already. It is whether the government of Barbados is willing to stand liability or offer compensation to any frontline workers, citizens, or their families who suffer adverse effects or death from having used the vaccine. AG, I'm sorry, would you wish to make a brief comment on that again?
That is one of the questions that was raised. The PM is fully aware of this, and the PM will shortly address the country in relation to the totality of what has gone on here. Look, we've come here to discuss, and the panel has tried to answer all the questions put, and we have been entirely respectful of you, the audience, at every single town hall meeting. This is the last of those meetings. We have accumulated a wealth of information that needs to be collated. It needs to be referenced with all of the resources we have, and then the best possible, most comprehensive solution put before the people of Barbados. This is not something we have seen before. It's something we need to look at carefully, and it's something that we need your feedback on to get the right solution. That feedback does not require us to answer every question immediately. It is important that we take your questions, that we consider them, and that when we actually speak on what the policy is, it takes into account the widest possible cross-section. That is what respect is. Respect is hearing every single thing that every one of you had to say. Winston, I have not even attempted to interrupt you at any meeting, nor anybody else who spoke. I have not been... No. You got it because I know your name. All right, no problem. But the point I'm making is we are here to listen. This is not a test. I am not trying to prove that I know more than you or the person who spoke, because I am not a virologist. I am not an epidemiologist. I am not any of them. I am a lawyer. So I cannot disprove anything that anybody in here says, but there are people who we take the information for and ask them, what is the truth about this? What is the best response? We undertake as a government that when we come down on one side or the other in relation to whatever policy we have going forward, and it must be carefully done, because this affects all of us in a way that very few things ever have in the history of our country. When we come down on that position, it is because we listen to all of you, we let all the views contend, and we came up with what is the best solution. So I'm not trying to prove you wrong. I'm not trying to win an argument with anybody in here. Let us not forget why we are here. We are here to understand, to ask questions, to get answers where possible, and if answers are not possible, to have our questions referred back so they can be addressed sometime later. Let us please proceed with the last hour with some degree of respect, understanding that although I do not agree with your position, it is not that I don't respect it, or it's not that I don't see it as any more valid than mine. Yours and mine and everybody else's must contend in the eventual solution. Next question.
Thank you very much, AG. Thank you for that function check. I think it's time now to move to some of our Zoom audience. We haven't had any of our Zoom audiences yet participate specifically, and I'd like to invite, if they're still there, RC. Unfortunately, this is the name that has been provided. RC, are you still there?
Hello?
Yes, can you hear us?
Hello, you hear me?
Yes, go on.
Okay, good, great. I used to be fairly short. I just wanted to, good afternoon, everyone. I see a major piece missing with this vaccine and testing push. The science states COVID starts with a viral phase, and if left unchecked, some cases will progress to the inflammatory phase, which is where hospitalization and death becomes a risk. Numerous doctors have developed effective treatments for both phases. For example, Dr. Shankara Chetty in South Africa has treated more than 4,000 COVID patients. That is more than our entire country has had positive cases. He has been extremely effective at treating the dangerous inflammatory phase with cheaply, commonly available drugs, so much so that his patients have had little to no need for supplemental oxygen or hospitalization, and at last check has had 0 deaths. Our pandemic will never end until an effective early outpatient treatment is added to our COVID toolbox. My 2 questions to the panel are, 1, why are we pinning all our hopes on a vaccine whose efficacy is dropping with every passing month, and not aggressively seeking out early outpatient interventions that work much better at stopping COVID? And 2, when are the early drug and supplement cocktail treatments comprising well-known and tolerated drugs whose efficacy has been backed by numerous published studies going to be officially added to our protocols so patients can be treated at home? Thank you.
Panel, can you provide an answer?
That Corey Ford is on the line. I hope he was following the question.
Dr. Ford, are you there?
Oh, yeah, I'm here. Good night, Barbadians. I think I got the gist of the question which was asked. So a few things. I think there were a few premises that were made. This is part of the issue here, but I will just run you through. So patients who have COVID, and the person is absolutely correct, I think it's a brilliant question. There may be two phases to the disease, and yes, we do use some of those relatively cheap drugs like dexamethasones, for example, to try to decrease the inflammatory phase of the disease, which people present with. So they present with bad problems in the lung, which often leads them to having to go on oxygen, etc. There are some other more high-tech agents we use. Tocilizumab, for example, one of the other expensive drugs, which is used in the US example for that particular example. But to answer your question in general, I think you made a few premises which I'm going to have to try to help you to walk through quite simply. So when people, I'm going to be brief. So when people get ill with COVID, for example, or they get the infection with COVID, which you know is there, some people remain asymptomatic, and we know that. Some people actually get the disease. But I always make the point that I only make the diagnosis of saying someone is asymptomatic with COVID after they've passed that phase of disease of the 10. So people can be what we call pre-symptomatic, or they may be in the process of getting symptoms. So initially they may present and have no symptoms and then develop symptoms on. We in Barbados have decided, and I think this is why our numbers in terms of deaths has been totally different in terms of to the rest of the globe, in terms of the number of cases which we've had. And it's been like that because what we do is to isolate individuals. And the reason is that, which you might miss, is that many of these individuals develop either symptoms in the facility, sometimes at day 3, day 4, and sometimes at day 6. They actually get severe infections in the lungs. Just imagine, and if you remember very early on the outbreak, when hospitals were overwhelmed and people turning up to hospitals and they say, you're not sick enough, go back home, for example, and come back. And by the time they come back, they say, okay, just go home and you take this and you come back. By they come back, they're on the ventilators and people have never even seen their families. That's just the reality of COVID. And we just take a look at what's going on to the Caribbean right now, you understand what we might be faced with in this country. So I think the idea of what you said in managing these things at home is quite difficult because we cannot predict whether or not you get the inflammatory phase of that disease and your oxygen in your blood becomes low. You might feel well, but I always say you feel well until you don't. And I think we have saved many lives in this country hard with late nights of working at this particular point. So while I understand your premise, the other leg of it is important. It's a totally unpredictable disease. Thanks.
Thank you, Dr. Ford. We also have on the Zoom Gordon Ashby. Gordon, are you there?
Yes, I am. Good afternoon, everyone. I want to address a question to Mr. Edward Clark. And I'm not talking about vaccines, but mandatory testing. I noticed that Dr. Fauci has recently declared that for persons with the Delta variant, the viral load of a vaccinated and people who are unvaccinated are the same. So I'm not a scientist or a doctor, but this would seem to me that why would you then want to mandate testing if this is the case? It doesn't make any sense to me. So I'd like Mr. Clark to, in light of this new information, to give me his take on this now. Mandatory testing of only the unvaccinated.
Mr. Clark, are you in a position or would you prefer the CMO to take this one?
Good evening, everyone. And Mr. Ashby, I've heard you. I heard your question. The position is that we believe in the private sector. We have to protect everybody in Barbados. Our opinion, which I think we have heard espoused numerous times by the health professionals in here, is that the health facilities simply cannot sustain a wide outbreak of this Delta virus, Delta variant. It is quite clear, if you go to 500 cases a day, what will happen to this country. If you all are not clear, let me make it very clear. This country will be destroyed in a matter of weeks. Economically, employment-wise, lives will be lost. I am not a doctor, I'm not a medical professional, but to me it is quite clear what will happen to Barbados. We in the private sector feel strongly that we need to protect that from happening, prevent that from happening. It is therefore why we suggested that we should have mandatory vaccines or mandatory testing, or both if we have to. We have agreed with the Prime Minister and the members of the social partnership to come to these meetings and to listen to the wider public. That is what we have done over the last week and a half. We have listened. We understand everybody has a choice to make. Our opinion is not going to be everyone's opinion or agreement, and that is clear. That doesn't mean you have to agree. This is a democracy, and we all have an opinion, and we are willing to share and disagree. That is what democracy is all about. It is our right to give an opinion, and it is your right to disagree. But that is why we felt that testing should be mandated, and especially in critical positions on the front line across Barbados. Our island simply cannot sustain a wide outbreak of COVID at this time or at any time. We are simply not prepared resource-wise, financially, economically, or lifestyle. It is simply not sustainable. And that is why we are urging all Barbadians to get vaccinated, get tested. And I'm hoping really and truly that out of this discussion, we can get much wider testing widely across Barbados. Because if people are not going to be vaccinated, testing has to be the alternative, or one of the alternatives used by the government and by the people of Barbados to survive this.
Thank you for your response, Mr. Clark.
I just wanted to add to the question.
Dr. Williams?
Yeah, I just wanted to add to the question that the questioner actually asked, and that was from what I understood, if fully vaccinated or unvaccinated people have similar viral loads. And while there have been studies that have shown that they have similar viral loads, here are two different things about the fully vaccinated. So fully vaccinated people may have the same viral load as an unvaccinated person, but for shorter periods of time, which means that transmission from a fully vaccinated person is less over time than from an unvaccinated person. So that's the first thing. The second thing is that the viral load infection does not mean necessarily disease. So if a person is fully vaccinated and they have the virus detected in their nasopharyngeal passage, their nose and their throat and their airway, it doesn't necessarily mean that they will go on to become ill. So there's a much lower probability of those people going on to disease. And it is the persons who are symptomatic who spread the disease the most. So although there is a possibility, there is a much lower probability of a fully vaccinated person spreading the disease. So when it comes to testing, if you're going to make a decision to test, the testing, of course, first should fully focus on people who are unvaccinated, those who are able to spread the disease for the longest and more likely to become symptomatic. I don't rule out testing fully vaccinated people as well, because if we have fully vaccinated people who have infection and they're moving among a population of largely unvaccinated people, then they can also give it to them. So I am not, especially with this Delta variant, saying that fully vaccinated people shouldn't be tested. I believe that they would be subject to testing, but perhaps with a lower frequency than those who are unvaccinated. Thank you.
Thanks again, Dr. Williams. Question coming from Linda Mohammed. Linda Mohammed asks, are the vaccines tested in Barbados before being injected into citizens?
So the answer to that is no, we don't have a formal way of testing vaccines. As I said, we observe and we move with the reputable agencies that have been so as I indicated, with respect to how we have run our vaccination process in the past, is very similar to how we run this one. And therefore, the World Health Organization and PAHO and other international agencies give guidance to countries that don't have in-country capacity to do testing. And we look at that guidance, and that guidance has served Barbados well for many years. One of the reasons why we have been able to weather the storm with respect to a lot of infectious diseases in children is because of our vaccination program. It has been one of the most commendable in the Eastern Caribbean. And I personally believe that we do not need to have a laboratory to second test vaccines which come to Barbados. I don't think it is in our economic interest to do that, and we have a track record to support that vaccines have been efficacious in Barbados. Thank you.
Thanks, Dr. George. I'm now going to ask Tracy Whitehall. Tracy Whitehall, if you're still on the Zoom, do you have your question to present to the panel? Or a suggestion to offer?
Good afternoon. Good afternoon. Good afternoon to the panel and to all the members of society. My question is this. We know that it is an experimental vaccine. What should happen? Should I allow my 13-year-old, mind you, she's never having it, I've already said that, but mind you, should I allow my 13-year-old to have this vaccine, and God forbids she has an adverse reaction? Who is going to take care of her? Who is also going to take care of me? So that is my question to the panel. Thank you.
Thank you very much, Ms. Whitehall.
Well, we have, even if it's an adult or a child, the reason why we built Harrison's Point is that we have had a history of taking care of individuals with COVID. So with respect to who is going to take care of your child, the state has always come in for Barbadians. We have had a history of free health care, and that continues. So that is the way how we will move forward. Your child will be taken care of. If you have a strong feeling that you want some comfort to know that your child, if it indeed had an adverse reaction, can come to any state-run facility and receive quality care.
Thank you, Dr. George. Dr. George, could you speak briefly to, or one of the other medical professionals here, could they speak briefly to booster shots? What is it? Is it something that we will need to consider in Barbados in the very near future?
I'm wearing this space shield as an extra layer of protection so that I don't send the virus spreading as I speak. Not that I have it, I've been vaccinated, but as an extra precaution.
Sorry, Dr. Cave, I don't think that persons are hearing you very clearly because of the mask. You don't have to take off the mask, but...
One of the things that we have learned in pediatrics is that a disease from catching a germ, whether it's a virus or a bacteria, means that the virus has gotten into the body and elicited an infection. What a vaccination is, it's like having the answer to the test. If you look at the infection as a test of your immune system, being vaccinated means that you have seen the question before and you have prepared an answer to fight off this disease. Now, the immune system is very complicated and has many ways of responding. And because there's so many tests that it has, it doesn't remember all the answers. So sometimes after you've been given a vaccine and you are immune for a while to fight off that germ, the natural thing is for this immunological memory to wane. And in order to keep a very high level of protection, you have to remind the immune system of the question so it can be ready with the fight against the disease should it ever present. Different diseases need to be reminded at different times. Everybody who brings children for vaccinations know that you get it at 2, 4, and 6 months. There's a booster at 18 months, a booster at 4.5, and an 11 plus. And that's for tetanus, among others. But if as an adult, you still get the likelihood of a nail joke or a pitchfork from a garden deep into your flesh, you will have another tetanus booster, just so that that immune system can produce the best possible response to the infection. It doesn't mean you don't get an infection. It means you respond to it, you deal with it, you curtail it so you don't get sick. So that's the theory behind having boosters. And as COVID progresses and as we are able to study how quickly the vaccine's protection may wane, we may well decide that a booster is necessary if the virus is still around. Nobody can tell you that in 5 years' time you won't need a reminder to your immune system because we haven't been studying this for 5 years. That's why the answer to when you'll get a booster is not yet known. But the precedent is there from all the other diseases that we have vaccinated against. You do your first immunizations and you maintain that protection through boosters.
Thank you, Dr. Cave. Let's take one more Zoom call before we return to the face-to-face audience. I'll invite Faye Armstrong-Lawrence. Faye Armstrong-Lawrence, are you still there?
I'm here. Are you hearing me now?
Yes, we can hear you clearly.
Great. My question has to do with the treatment that we are really, what's available, because there are some persons, these are doctors in other countries who are saying that they got good results. They used to said things like ivermectin, hydroxychloroquine, and budesonide. So these are some doctors who are saying that they got good results treating persons who came into their care using those. So my question was, have we considered or have we utilized any of those drugs? And they said they're what they call the repurposed drugs, and they're safe. They've been around for a long time. And in using those, they found that the persons were recovering well. They didn't have to go into they go on the ventilators, and they found that the results were good, and these were already available. And one doctor was even suggesting using in early treatment so we don't get into the heavy viral load. So I just wondered if those three, ivermectin, hydroxychloroquine, sulfate, and budesonide have as yet or have ever been considered to be used for any of our persons in this country who tested positive for the virus, so that because I think we all want the same thing. We want good outcomes. We don't want to overburden health system. That will be beneficial to no one. So I'm just wondering, what are the other treatments? Because I'm thinking, let us see how we can utilize what's already available. The cost shouldn't be high because these drugs are available. So I'm just, that was my one point. And then there are persons who now don't want to go the route of pharmacology medicine. They want to do a natural route, and they've also found the results. So I'm thinking, I hear things like risk versus benefit, and I'm thinking that we want the same thing, healthy people. We want to deal with this virus and manage it well. But I would like to introduce that. Let us have good, if you have a good option, I think we should be able to do that. And at all times, I'm thinking between doctor-patient, the patient always has authority, responsibility. You, the doctor, gave me information. I think it through. I think, okay, this is what you're saying is wrong. Maybe I will take what you suggest, or I can find another method that will get me the good result. So that is my thing in relation to how we are approaching it at this stage going through. Because if we are going to deal with this virus for who knows how long, I would like that we put all the good options out there and give persons a good choice, as opposed to just thinking that utilizing this new jab is the only way. I'm thinking that there are other ways we must investigate, and we should get good results to meet needs. Not just give me a list of varieties in vaccinations, but give me varieties in treatment, whether I want to do a natural route, whether I want to do repurposed drugs. Give me options in treatment. That was my thing. How are we doing it here?
Thank you very much, Ms. Armstrong-Lawrence. Any response from the panelists?
I will let Corey make a response, but what I will say is that we have been quick to, in Barbados, so whatever the scientific information suggested that the treatments are available, so we have antivirals here. We use dexamethasone. Corey will have to speak on hydroxychloroquine. The data on that is not as strong, but I think that we have used the best available medication in Barbados, and that is one of the reasons why our death rate and the quality of care in Barbados is high. But I would just like to caution the caller that this discussion is about prevention, and while you are speaking about cure, we don't want situations where people end up on a ventilator or end up with CPAP or end up with extra oxygen. And that is when the person has gone too far. There are too many instances where individuals who are on their dying bed are asking for vaccination. It will have no use at that point in time. Vaccines give you the best prevention. That's if you take it, because it's your choice. However, looking at treatment where you are maybe indeed sick is not the route to go. But Corey will speak to the issues. You spoke about some of the home remedies or homeopathic remedies that may assist in individuals, and I certainly am not the competent authority. I will ask Corey to make a comment.
Good night again, and thanks to the Zoom caller for that question. I'm going to surprise you, right? So I'm going to surprise you. Very early in this outbreak, many of the drugs which the speaker spoke about, so hydroxychloroquine, we didn't speak about dexamethasone, for example, even ivermectin, we actually stocked up on country because we were waiting for the evidence. Because remember, this is new. There's no antiviral to this day that we know for sure will certainly fight this infection, for sure. We don't know that for sure. So using some of these other agents, so have we used hydroxychloroquine or chloroquine? Yes, we've used it on only in about one patient, and that did not work. Have we used ivermectin? No, we have not. And there are currently ongoing studies, certainly with regards to this globally at this point, and there were previous studies which are conflicting. So there's several studies, WHO looked at it as well. Many different studies are conflicting online. So as much as you can find to support the use of ivermectin, you'll find as many as not. So my Society of Infectious Disease Society of America at this point has put that on hold until there's more evidence. And I agree with you, people have had success with it, or they believe they've had success with it overseas. I can't say that for sure. I think we need more evidence where that's concerned. In terms of herbal remedies, we have not used those agents. And like I said before, truthfully, look, the only drugs that we know for sure to have any definitive good from studies that have gone up is a simple drug such as dexamethasone. Has made, I think, a big difference in the world in terms of dropping that inflammatory phase of the disease. And there's several studies which have shown that, and that one I can tell you for sure. There's some other new biologic agents that are in use, and I agree, they're expensive agents, and we do have some of those in Barbados, which we use and have had great success. And I think, as you think about this, I mean, it sounds easy for you to use some of these agents, but yes, drugs like hydroxychloroquine, any drug you take has consequences. So people will say, oh, yes, use ivermectin because it's cheap. Yeah, it's cheap, you're right. Yeah, it has minimal complications, but the point is it can have complications, and you have to be sure as a physician that you have the evidence, which is clear, not based on if someone uses it. I may use Panadol to get rid of my headache. Another person might use Panadol and might not work for them. But does it mean that it's the overall drug for use of a headache, or for example? So one has to be very, very careful how one uses drugs. I think we've used, like I told you, I was surprised you that we've used some of these agents and attempted to get our patients better. But some of the more newer agents which we used and had great success. I keep saying that 48 deaths is a small amount, but one death is not good enough. Thanks.
Thank you very much, Dr. Ford. Ladies and gentlemen, we will be coming to the face-to-face audience now, but if you would allow me, Dr. Graves, I believe you had a comment you wanted to make in regard to the presentation just now on Zoom.
It's really in relation to the dialogue that we're having over the past 4 weeks. I've had the good fortune of coming to every meeting, and it seems to me that increasingly we're speaking past each other. As Barbadians, we are speaking past each other. This is not about whether COVID is real or if the vaccine is real or harmful or hurtful. It's about solutions. So as scientists, as physicians, as public health professionals, we are not trying to strong arm anyone. We're trying to present the evidence as best we know. In April last year, when COVID was first arising, there's a COVID UE group, and we do research. So there's been a call, what's UE doing, or what research is being done? And I remember sitting down on my bed a Sunday afternoon, looking at the epidemic in Italy and working out what the epidemic would look like in Barbados. Should we have the same level of transmissibility and the number of people dying? And I'm not ashamed to tell you that I cried. I sat down there with those papers around me, and I cried. Because I understand that there are people here who do not believe, and it's not my responsibility to tell you to believe, but it's my responsibility to say, what is the risk if we don't come up with real solutions? If you are not wanting to take the vaccine, no problem. Last week, on Monday, I followed Winston out. Because when Winston got out and he was walking out, I was like, why is he walking out? This is so disrespectful. Why is he walking out? I can't understand this. So I went to him and said, Winston, why are you walking out? Why are you walking out with dialogue? And he explained to me he wasn't walking out. But his medical conditions or whatever, his history, his story is different. It's different to my story, but it nonetheless takes away from the fact that we are in a really difficult place in Barbados. It does not take away the fact that if Delta variant arrives here in a substantial way with a higher level of transmissibility, I don't think if we understand, I'm really not figuring out if we understand what could happen, whether you believe it or not. Are you wanting to take the opportunity to actually see it happen? I grew up in Barbados. Honest to goodness, I am blue vex right now. Blue. We have this thing in Barbados, we like to go to funerals, and we like to watch this and that. We really want to see what COVID could look like. We saw what Bahamas is going through. We know what Jamaica is going through. We know what's happening in Dominica because of their close relationship with Guadeloupe and Martinique. We know what's happening in Trinidad. What is it that we are waiting on? So there is a framework of thinking called solution-oriented thinking. And what happens is when you're having an argument or a discussion and it's going back and forth, and every time you come with something, so the first town hall meeting, it was like you want data. The second meeting, you got the data. Then the next thing is, we cannot catch up, but we cannot have the real world experiment to see what would happen. We cannot afford the real world experiment. So for the people,
Dr. Graves.
So for the people who are coming after me, or for Winston, or whoever who got the following and the leadership and all of this kind of thing, come up with solutions. Solutions.
Dr. Graves, we must ask you to wrap up.
I'm ending.
Now.
Public health. I said. Wait. I just want to finish this last sentence. My background.
Please, ladies and gentlemen, please, let's
background is that I'm a medical doctor, and most of the persons that I look after have conditions that they cannot recover from. They have cancer, they have renal failure, they have heart failure, and various kinds of things. The NCD burden in Barbados is too significant to risk. All I'm asking is to the persons who do not agree with me and who don't agree with everybody else, just to be respectful and to provide solutions. Because right now, all we need is solutions. How are we going to stop transmission? How are we going to stop mortality? How are we going to stop morbidity? Even if you don't believe it, you don't have to believe it to come up with a solution.
Dr.
All
Graves.
I'm asking is for a solution.
Thank you, Dr. Graves. And I think, ladies and gentlemen, I'll be very honest with you. I think we have to give some latitude to Dr. Graves and others like her who are on the front line facing death and facing the reality of this situation. I think we have to be sympathetic to the passion that has been exhibited by her this evening. Now, ladies and gentlemen, we have about 18 more minutes to go before the end of our session tonight. This is the batting order. I hope I've chosen a good team. First of all, the gentleman in the fedora who is at the microphone, followed by the lady in the back in the purple shirt. She had been waiting for some time patiently seated at the front. The gentleman seated here in the black polo shirt. The gentleman in the white shirt at the front in the center. And the gentleman in the green shirt seated in the middle. Those, ladies and gentlemen, ladies and gentlemen, those are the persons who we will be having before we close. That's 3 minutes per person, and I know we can get this done because we want to hear from you all. The others who have not been chosen for this evening's lineup, I ask you to please remain seated at this point in time. Sir.
Good evening to everyone. I am the Ras Bongo Spear, elect of records of the Nyabingi tribe of Rastafari in Barbados. I wish to offer best greetings to the Order of President, the Acting Prime Minister, the Minister of Home Affairs, the doctors, and each and every one. Now, we have met within our church environment, so my presentation is coming from an ethno-cultural, it's coming from an anthropological, and it is certainly based on our spirituality. So I urge your patience, sir. Our community is vehemently opposed to any form of enforced or compulsory vaccination or inoculations of any sort. That is clear from our position. Listening to the argument in here this evening, I am concerned, and some persons would have mentioned what I would present as mass psychosis, which is the fear, the anxiety, the pain, and all of these different mental aggravations that is being occasioned by the, perhaps the way that COVID is being treated by the government and how citizens are being recognized or not being recognized. So I would like to urge the government to think clearly about the psychosis that is affecting this country, including psychosis of the government, totalitarian psychosis. It is very important. This is what is going on at the grassroots level and how people are perceiving the polity in terms of this particular illness. Now, there's a virologist. His name is Luc Montagnier. He's a Nobel Prize laureate. And recently he opined that mass COVID vaccination is an unacceptable mistake that is creating the variants. Of course, he's a virologist, and the group up there can deal with that. The name is mentioned. He concluded certainly that in every country, the curve of vaccination, of course, it is followed by deaths. So that's one point. My question on the COVID question, does anyone on the panel knows the cause of COVID? You can think about it.
Panelists, would you wish to put forward from your knowledge what you believe is the answer?
I can only tell you what we know. What we know is that the SARS-CoV-2 virus, which we have now, has 96.2% homology with a wild-type bat coronavirus that was found in China, and that homology suggests that there was animal origin, but we are not 100% clear about all of the origins, but we know that it is homologous to what is coming from animals, and there is a suspected species jump, meaning that the virus moves from one species to another, which we know happens with many other viruses. What is unknown is the intermediate host. That is which species it moved to go from bat to the intermediate host to humans. And so there are lots of questions there that still remain unanswered. So I can only share with you what we know at this time.
Thank you very much. Very, very gentle.
Thank you very much, sir.
I'm not finished.
But
please,
sir, we're in the rapid fire session right now.
I'm not finished, sir. Please, sir. I'm not
sir,
finished, sir.
Unfortunately, we can no longer take any further long presentations because we have to allow persons to speak.
Allow me to conclude, sir.
Sir, I'm very sorry, but we're moving on now to the lady behind you who is in the purple shirt.
Sorry, wait.
Sir, we're moving on to the lady in the purple shirt behind you. Ma'am, please come to the microphone at the front.
Good evening. My name is Paula Bradshaw. I was just indicating that the gentleman in the white t-shirt was standing there before me.
I'm terribly sorry then. Would you wish to give way to him, ma'am?
Yes, I
if
will
I
give
made
way
that
to
error,
him.
I'm terribly sorry.
It's okay. I will give way to him because he was standing there for even longer than I.
I appreciate that. Thank you, ma'am.
My name is Curtly Gibson. Thank you very much, Lady in Pink. I appreciate it. Yeah, I operate from in Mar Hill Street Vendors Mall. My concern is that if this experimental drug becomes mandatory, then I might have to end up taking it just to survive, and that I can't go into the market. So I am against the mandatory vaccination. My solution, restore to the people their freedom to take care of their own health. And my next solution also is the same way when we go into these businesses and you have to put your hand and get the alcohol on your hand. We could have some dispensing unit that would probably give some vitamin D, vitamin C, some zinc, and some of the other stuff that have been proven to work that are very cheap and very effective. I am really disappointed in the way that the doctor have dismissed or seem to have really looked down lowly upon these things like faith, the herbs, and the cheap medicines that have been working in Africa and other places. And that is my suggestion.
Is there any response?
Hey, can I just say that while we're cleaning the microphones, it's not a dismissal of things like vitamin C. It's kind of thinking about the Swiss cheese model. You know, we are using all the things. So you want to protect your immune system. You want to make sure that when you have your vaccine, your immune system can go against it. So we're using everything at our disposal. We don't want to throw out anything, including the vaccine. I also want to say, or you were, go ahead. I also want to say a couple of things. One, I think it's incorrect to call the vaccine experimental. It is new and not experimental. It is now in phase 4 trials, so I'll call it new and not experimental. My words, not yours. And
in the purple.
From the person who said before, COVID-19 vaccinations, in no country has COVID-19 vaccinations been followed by deaths. That is not accurate. All right.
Sorry, Dr. Sobers, I don't think everyone heard you. Could you repeat what you said, please?
Pardon?
Everyone, please, just give Dr. Sobers an opportunity to respond.
I said, you mean the experimental? Or that in no country, somebody said that COVID-19 vaccinations has been followed by deaths. That was a statement by the gentleman who had on the hat, that nice outfit. So I was just saying that in no country has COVID-19 vaccinations been mass followed by deaths, as in, you know, there was a disconnect, actually, and Prof. Landis spoke to it, and in many countries where you have COVID-19 vaccinations, there's been a decrease in deaths overall. Where the US did not have COVID-19 vaccinations last year, their life expectancy actually decreased by 1.5 years. So that's showing you the connection with COVID-19 itself and deaths.
Evening again. My name is Paula Bradshaw, and I would like to back up what my brother said. I think Barbadians need to get back to the earth. We need to get back to the superfoods that God has provided for us to make us strong and heal our bodies. They're all there provided for us. And I think we are in a Western culture that rushes straight to medication, synthetic medication, instead of checking the natural stuff first. Mr. Moderator, there will be no gully-boar behavior from me, and if you see any, I give you permission to correct me and reprimand me as swiftly and sternly as you did the gentleman who you thought was hogging the mic on Monday evening. My question I think I should direct to Dr. Ford, if he's still with us.
Yes, I believe Dr. Ford is still online, yes.
Dr. Ford, many Bajans have a deep distrust for politicians and doctors, but somehow, just as Princess Diana became the queen of people's hearts, although the British hated the monarchy, the Bajans seem to trust and love you. A lot of Barbadian parents many of whom have already been vaccinated, are wondering if and why they should have their young, strong children of school age vaccinated. They're hearing about horrible side effects of children who live in vaccinated homes, where it is said that the spike protein shedding is causing severe illness. Things like blood clots, paralysis, myocarditis, inflammation of the brain, migraines. Yes, they have heard that 905 breastfeeding babies of vaccinated mothers have died, and many others have overwhelming inflammation in their systems. They've heard that so many vaccinated people have become ill, and I believe, forgive me if I don't remember exactly who, mentioned the database for adverse reactions, and many of you probably already saw the data available in Europe and in the US. There have also been over 10,000 deaths in Europe and the US as a result of the vaccination, and hundreds of thousands of illnesses directly related. We know of 23 right here in Barbados, and that's just my small group, eh? So, the question is, one, do we have statistics which show us how many Barbadians have been infected by the COVID-19 virus or bacterium and have remained healthy? Do we have statistics? No, we can't, because we haven't tested everyone. But many suspect that there are lots of Barbadians whose immune system did what it was supposed to do, all the yams and edibles and breadfruit and sweet potato, right? And the lemonade and the good rest at night fought it off. Similarly, what percentage of our children have been severely affected or died from COVID-19? Because if the percentage is extremely low, why are we going straight to vaccination instead of to the healthy eating and the healthy lifestyle?
Thank you, ma'am. Let's hear from the CMO or his team.
The parents, Dr. Ford, can you assure the parents, the grannies, the caregivers of our Barbadian children, of our most important and precious resource, can you assure them tonight? Can you give them their word? Give them your word as the doctor of Barbados that most of the people trust. Can you give them your word that our children, our beloved children of Barbados, will not face these horrible, horrible side effects? Well, they're not they're huge effects of the vaccine, and that their future will not be cut short. Can you give us your assurance tonight? Can you look the parents of Barbados in their eyes and say they absolutely will not end up that way? That's my question. I thank you.
Thank you, ma'am. Dr. Ford, any response?
Good night. Notice I've changed my attire. I have an emergency. But I will during this short period of time, try to give an answer to that and try to assure all Barbadians. Listen, we are faced with a difficult time. I'm very straightforward. I cannot tell you that your child may not at any point have any adverse effect to any vaccination, whether it be MMR, polio, any vaccination. I can't tell you that for sure. What I can tell you for sure is from the evidence that has been gained with regards to the COVID-19 vaccination at this point, I can tell you 3 key facts. Fact number 1, even in the advent of Delta, in the 60s%, it's about 63%, the risk for infection is down. For the ability to spread, about the same. But one fact I can tell you is for your kid, if you're listening to me tonight, their risk of getting ill in terms of getting hospitalized, and I'm sorry, I'm not going to get emotional, but I know that there are now many situations globally, and if you listen to the news this morning, you will see that kids, unvaccinated kids, are people who are not even in that population where they can be vaccinated, that Delta is beginning to take a turn in them. If you remember very early in this outbreak, I would have always said it was our older population, right? So your old granny living at home, my granny, your granny living at home, that they were the ones who were going to get ill. When Delta and Alpha hit, it changed. Delta has changed things dramatically. So we're now talking about people in the 40 years group, right? I'm about to leave home to go to Harson's Point to deal with an issue where that is concerned. Okay, and now we have a larger population there. In our children population, what you don't know is that, we had a kid at Harson's Point who was intubated. We gave her a fancy drug and she's got off. She was about 15 years of age, right? And pediatricians work hard with her. Yes, so because you're young, doesn't mean you can get complications. We had a kid who died with the post effects, and this is what you have to remember. So while you might say, okay, don't give my kid it and they get COVID, I do, just as you're saying on this call tonight, that you're not sure what complications the vaccine may have in your kid. And I can't tell you that your kid may not get a fever or some other side effect. I can't tell you that, right? But what I can tell you for sure is that we have enough evidence that kids die from post complications of COVID-19. We all know it. You see it on TV. You see NBC, CBC, Canadian television, for example, right? CP24. They will show you that kids get complications when they get COVID. Not even if they don't get it during COVID, they can get it post-COVID. So when you say, hey, I'm not sure what complications my kid can get when they get the vaccine, right? I will also tell you the complications that we know for sure that when they get COVID and it happens later, they do occur and your kid can die, right? And that is what I want you to understand tonight. So as you go home and your mother, I'm never going to stay on this call and talk to you straight, right? I'm never going to stay on this call tonight and tell you, yes, you have to take a vaccine or this mandatory vaccine. I believe everybody has that choice. That's my personal opinion, and that goes outside of my medical profession right now. But what I can tell you for sure is the evidence is really clear in that your kid is not going to get hospitalized and put on a ventilator, and you'll be suffering because you're not able to see the kid and do all the normal things you do with your kid 5 or 10 years later. So I just want you to bear that in mind, and I hope I answered your question like I wanted to, but I just want to I'm not going to go off topic if they allow me for 5 seconds to tell you that the advent of Delta, I have had calls from many of my colleagues in the Caribbean all night. I'm up straightforward, right? Having calls from all over the Caribbean because people are sick, right? And many of my colleagues, especially ICU, have been being called all over the Caribbean. This is real, right? And if we don't make the right decisions, right? Nobody's forcing you, but if you don't make the right decisions, there are consequences for you. If you want to live to see your kid get 20 and 30 and 40 years old and get married, you have to make those decisions on your own. If you make the wrong decision, right? That will not happen because the evidence is really, really clear for all the vaccinations, right? Straight. I'm not here to sway you or anything. I'm just telling you the medical facts and the numbers are clear. Even in the great study that came out of Israel recently, where it showed that was 63%, which I just said, the most important fact about that is 93% of persons where did not have to get hospitalized at all were vaccinated. Look at the statistics for Bahamas. I'm not, just go and look on the Caribbean where I said, go and look and see what's going on in the rest of the Caribbean. It may be weeks, right? It may be days. If we don't make the right decisions in this country, we are going to be in big trouble. Do trust me when I believe. So look around us, right? We will be no different if we make bad decisions. The difference in the US is they got their vaccination rates up. That's why things are a bit different. Yes, so people are getting infected, but their hospitals are only being overrun in states where the vaccination rates are low. Look at Canada. They've really done a great job in terms of their vaccinations. You're not hearing much coming out there in terms of hospitalizations, only in the provinces where things are bad. Okay, I want you to go, don't mistrust me, just go and look and see for yourself, right? The evidence is there. Look at Jamaica right now with their vaccination rate. It's down and hospitals can't even take patients, far more ICUs. Do we ever want to see that in Barbados? This is not for fear mongering. I'm not giving any, I want you to be fearful today. I actually want to encourage Barbadians, right? So I'm going away from the fear mechanism. I want to encourage you to make good choices, not only for you, for your granny who you live in the home with, to make good decisions for your child who you're in a house with, who does not want to be a mother or father, right? These are important decisions that only you can make. Nobody can make them for you. I can't tell you, you have to take a vaccine. I think that's wrong, right? But I can encourage you and give you the evidence that's required. And we might not always agree in it, but ultimately, the way how I see it, the decisions we make can affect the course of what's happening on the ground in the healthcare system, right? And many of us are working extremely hard and many long hours, certainly at many of these facilities to save many lives. Using some of the drugs you've mentioned, right? I think someone mentioned about drug therapies, etc. And we're doing everything. We use every single thing to save lives. That's what we have done for the whole of this outbreak, and we will continue. Just as we're advising you strongly to take the vaccine to stop the course of what's going on or what can happen in this country, right? You have that choice. It is your decision tonight for you, your family, and your children, and your granny who can't do no better, right? And we've seen many households in this country ravaged with COVID-19. And yes, many of the young people have been fine, but many of the older people have died. I challenge you tonight to rethink things, relook at the data, listen to what we've said over the last town hall meetings, and ultimately you make that decision. But remember that the decision you make affects every single person around you. It could even affect your income in terms of if things go out of the hall, we worry about costs of everything right now, right? I'm worried about costs of everything. But decisions you make can impact this country greatly. That's all I can tell you tonight. And I'm asking you to trust me in this particular aspect. Trust me in getting back your children to school. Trust me in these issues tonight. That's all I can say. Thank you.
Thanks very much. Thank you, Dr. Ford. Go ahead.
Hi, good evening, everybody. I was looking around the room all evening for about 2 hours, and I know you probably wondered why, but I realized very early that I'm the youngest person in the room. And that may be a blessing or a curse, but we're about to find out. I want to first start by thanking all frontline workers, whether nurses, doctors, law enforcement, and all of that ilk. But before I get into my question, I wanted to help the audience here to understand that the youth are watching. And while I'm not here to represent the student guild, even though I'm wearing my shirt, I want us to understand that there's some serious tension among our youth. And now that I'm in this room, I realize where it's coming from. Whether pro-vax, pro-choice, or anti-vax, we must be responsible and appreciate each other's views, because there's some serious tension building among the youth. And then we wonder where the violence is coming from. And then we wonder why is the national anti-violence campaign starting. But it starts in this room. It starts in this room. I'll get into my question now. I know it's getting late. No, sorry, it didn't start in this room. It didn't not start in this room. No, sorry, not starting in this room. Not literally.
Sir, just
but
focus on your question.
This is where it builds. I want to know what about the children. Sorry, not children, because students don't have to be children. And I want to know what about the students going back to school who feel, and I won't use the term protect vaccinated from unvaccinated and unvaccinated from vaccinated, but I want to ask the question, how do we not rob students of their student experience? I want to ask the question, how do we ensure that everyone gets their value for money going back to school? Those are the questions I want to ask. And the final one is, I know that many persons attend these meetings and they walk away with information that they want to walk away with and not what was actually said. So imagine my surprise when persons came cursing me saying that Professor Landers said vaccinations at UE are mandatory. So I want you to reinforce what Professor Landers said. All right? And my solution here now, my solution to end is in the same light that we have these town halls, to represent the youth, I suggest that we have a town hall specifically for youth. Let's go to the youth and consult them and not just sit and make decisions without them. Because as we can see, I'm the only one here. It shouldn't be. It shouldn't be. I'm sorry. But we define youth as 13 to 29. I'm sorry for whoever fits into that bracket. But I close there. Thank you.
Thank you very much.
I just want to thank you, young man, for your contribution and for highlighting, in a large respect, the tension sometimes that exists between us. We may not always agree on everything, but I think, again, it is important that we're respectful of each other. You are perfectly right. The consultation is wide, and it is a consultation that will also be with our young people as well. We are mindful that while parents have the right to make decisions for
Ladies and
those
gentlemen,
who are
please.
underage, the truth is that we also have students who are in the tertiary institutions as well, who also are part of this conversation. And therefore, it is imperative that that discussion is also with them as well, and that they're able to make choices. So I just want to commend you. I hope that you can help to encourage others to be part of the discussion and to step forward and to be able to share your views as well. Thank you.
Sir?
Thank you. Yeah. Hi, good evening, all. I'm Mark Ford. A number of things have surprised me that were said in here this evening. I know there's a gallery, so if I come here and say, hey, I ain't taking a vaccine, there's gonna be a big bunch of applause. That's not what I want. That's not what I'm here for, okay? There's some things that were said in here that bother me. For example, lip service is given to health and wellness in this country. That is not true. That is a lie. Every day, health professionals and other people involved in nutrition speak to the high blood pressure levels in this country. You all know it's true. Speak to the cancer in this country. Speak to the heart disease in this country. Speak to the diabetes in this country, which is so high, right? Dr. Fraser, I am sure these doctors here and others out there that you and your children attend, right? Speak to eating healthily, eating more fruit and vegetables. That has nothing to do with COVID. What some of these doctors have said tonight is, look, yes, eat healthy. You need to build your immune system regardless. You want to I take vitamins every single day for the last 20 years. Every day. But still I'm fully vaccinated. I can't simply say, look, I take vitamin C, vitamin E, zinc, all the rest of it, the B complexes, right? So I think it is unfortunate that people get in here and say that this country has paid lip service to health. It is not true. The other thing is cost of eating healthy. The cost of eating healthy is not expensive. People believe, give me a chance, give me a chance, give me a chance.
Everyone.
Listen. Go and buy, if you go and buy 6 lamb chops with all the fat wrong, it's going to cost you about $30. Go buy 6 bananas, it's going to cost you tops $6. Yes, I'm serious, I bought bananas yesterday. You buy a bag of apples, they cost less than $10. So don't tell me about eating healthy is expensive. Anyway, I know time is running away. Look, people, this is a pandemic. Not a single one of us in this room alive now has experienced a pandemic before. What does that mean? It means that decisions have to be made based on this fact. This is not the cold. This is not the flu. This is not a simple flu. That's a fact. I'm only speaking facts, right? It has affected the entire world. The entire world. Not a country has been spared. Okay? Now, the fact remains, our tourism has gone to shot. If we don't make the right decisions in this country, a lot of the same reluctants and anti-vaxxers will be out of work, and this economy is going to hell in a handbasket. Why? Because we have to reach herd immunity. Well, what is so difficult to understand about that? And some of you very people who they say, we ain't want this and we ain't want that, we ain't this and we ain't doing that, you're all going to suffer. And then they're going to blame the government. That is what's going to happen. That is what is going to happen. The best defense that we have right now is the vaccine. It's as simple as that. Is the vaccine. No, I am not here to take away your choice. But what bothers me about the people I hear on the call, I'm going to wrap it now, sir. Yes, sir.
Ladies and gentlemen, I have to ask you to please be considerate to the speaker. Please be considerate to the speaker. Mr. Ford, and I must ask you to please wrap up urgently.
Yeah.
Thank you very much.
Thank you as well. Thank you as well. People go on the net every day. You know what? I can believe anything. There are people called flat earthers. They believe the earth is flat. And they can go on the net and they can find, don't mind, they can stay on the moon and see the earth is round. They're not interested. So they go on the net and they find whatever they want to find. And that is what I think is happening here a lot. Look, let us, I'm asking y'all, just deal
Mr. Ford,
with
your final
the
point.
truth.
Mr. Ford, your final point.
Yes. Don't just simply say, this is my position, I go on the net and find whatever I want to find by Kurt Von Boss or whoever. You know, I mean, that's what a lot of people are doing, and it's sad. It is very sad. I live in this country, and I want the best for it. I still say the best defense for us is take the vaccine, let us save the economy, let people get back to work, and save our lives. Have a good night, everyone.
Thank you, Mr. Ford. Is Mr. Greenidge on still? Mr. Greenidge is on still? Yeah? Okay, no problem. Which young man? The blue? Donovan was first. So you want the guy in the blue as well? All right, we're going to have Mr. Donovan, and then the gentleman in the blue shirt, and then we're going to go to Mr. Greenidge to Doc. Ladies and gentlemen, please. Ladies and gentlemen, please.
Good afternoon.
We have had 4 very orderly sessions. Let us not bring this down.
Good afternoon. I was here for over 3 hours, waiting patiently, and from the time I came, I indicated my hand up in the air. I waited my turn. I was given authority to speak at number 5. So those who came after me, please understand I was waiting for 3 hours. Good afternoon. Welcome to everybody. I like a little respect, please. I listened for 3 hours to everybody's views. I would like the respect to be shared. I have 2 things to say.
Your
Presentation.
Name, your name, sir. Your name.
And a suggestion. Adrian Donovan. I had an experience a few weeks ago whereby I took 3 young fellas in my car. Young fella gone. I was late to go to a practice, and I put all 3 in my car. And because I was late, I took off my mask. I had wearing a mask. I was getting to the practice. And I jumped all 3 in my car and went down the road in a hurry to get the fellas there on time. I did that. I achieved my goal. Lo and behold, I didn't know that the next day, one particular fella get picked up by the bus at McDonald Harrison Point. Lo and behold, I didn't know, because of that particular fella, the 2 other young boys who was in my face, in my car, I done them a favor, ended up down in Harrison Point. Lo and behold, I didn't know, within the next 48 hours, one fella was a ventilator. Lord have mercy on my soul. The whole week, I could not sleep, I could not eat, I could not drink. I was saying all the time, what have I done? I went out of my way to do a favor, and somebody in my car infected me. Possibly infected me. But the Lord is a good Lord. Because on May the 9th, Saturday morning, I went down at Harrison College at a pop-up with two of my friends, waited for 7 hours, the most beautiful, enjoyed 7 hours in my life. I stood up in a line and waited to get my job. And in those 7 hours, we shared old talk, we shared drink, we shared fruit punch, we talked for 7 hours. I waited for my job. And if it wasn't for that job, on the 7th of May, I believed that I could be in Harrison Point now on Westbury Cemetery. I follow the science. I am not telling anybody what to do. I'm speaking for myself. You have a choice. Men marrying man, woman marrying woman. When you got headache, you buy Panadol or you're going to buy Advil. When you want to have sex, you condom or you get AIDS. That is your choice. I made my choice. I respect the people who came here tonight and criticized and made it. I sat down and listened and took and heard everything. I respect their views. My mayor man tonight, who was very critical, Ronnie Clark, my mayor man. At the end of the day, we could talk. We don't share the same views, but we respect each other's idea. The suggestion I have for the members of the panel, Dr. William, George, etc., we need to get the information out to the young people like him. He's about the first man that was at these 4 meetings. I was online all 3. I took particular note. And I am concerned about these young people. Because when I see them on a day in my community, and I ask them why you don't get the vaccine, they tell me, Mr. Donovan, Oki, Redman, whatever you call me, and they got a bush tea in Africa that can knock out any variant. A bush tea in Africa, yeah. So I said, okay, fellas, the problem, man, maybe get it, we could drink it, and we could go ahead and sign me. So we went, give me a little respect, please, now. Give me a little respect. I listen to you. Give me a little respect. Give me a little respect. That's all good. So let me go on. So we were going on the road here now. Praise the Lord, the fellow came up with ventilator, Dr. George, and he's happily home with his family, and I'm happy for him. I'm happy, I'm very grateful to you, Williams, Ferdinand, Cave, Chapman, all of them. I owe you gratitude. If I stood home and said I could take a Panadol, or I could get Sershi in my nose or parsley, I don't know what would happen. You understand? That was my choice. Now, you can't tell me what to do. I am suggesting to this committee here now, 32% of the population has been vaccinated, 32. We got a problem. We got a problem. We're doing things wrong, we got to change. We got to upside the box. And I recommend to Dr. Williams and Dr. George, we got to do something different. I'm recommending the people that are not coming for the vaccine, we got to take the vaccine to the people. We have to take the vaccine to the people. I'm recommending that we have more pop-ups and we go into the housing areas. We go into housing areas and we spend a couple of days in the housing areas, pop-ups. It was done at Harrison College. It's going by me in the gymnasium. You have pavilions, you have community centers as a base. You bring in 2 or 3 tents, as is done at the gymnasium, and you could do the testing there, you could do vaccine, whatever you want to do. I am suggesting we go in the housing areas. The housing areas are the people, Dr. George, who are mostly against taking the vaccine. We need to get them on board. Whether they come, we have to try. We need to get in the Pine, Valerie, Britton Hill, Station Hill, Belle Plaine. You could call all the housing areas. We need to get up there. We need to get the young people understanding and educating them what is needed for the vaccine. And my final point, my last point, I want to congratulate the government of Barbados, the Honorable Minister of Sport, the COVID-19 monitoring unit for allowing the young people of this country to start cricket from September the 11th all across the length of Barbados. We have been locked down for 2 years. And despite Dr. George telling us today we have 10 clusters, 32% vaccinated, over hundreds of people uncertain. You all have allowed us to get out of our house, to get to recreation, fresh air, and to do what we love best. Madam Prime Minister, Honorable Attorney General, George Williams, we owe you, on behalf of the sports-loving people of Barbados, I want to say thank you to the bottom of our heart. Thank you.
Thank you, Mr. Donovan. Sir, in the blue shirt, this will be our final presentation, and then we'll have Dr. Greenidge, who I believe is online, from the health economics perspective, and Dr. Williams wrapping up as well.
Yeah, good night. My name is Anderson Marshall. Yeah, good night to the prime ministers and doctors and coming back, and everyone. Yeah. I got one solution. That solution was the man Dr. Sebi that day. That your body is either alkaline or acidic. So if your body is more alkaline, no virus cannot live in your body. That is my solution. Eat properly and exercise. Ain't nothing else to do. Your body can only be acidic or alkaline. If your body more acidic, it can take you out. But if you get an alkaline body, it cannot live in an alkaline state. That is my question to Corey Ford.
Thank you very much, sir. Thank you very much. Dr. Ford, do you want to make a quick response? Or Dr. Williams, would you like to make a quick response to this? Ladies and gentlemen, I think we have Dr. Greenidge on the Zoom who wishes to make a contribution.
Good afternoon, Barbadians. Am I on?
Yes, we can hear you loud and clear.
All right, good afternoon to everyone. Good afternoon, Barbadians. I just want to offer a perspective as it relates to balancing and what we are really facing. And why these discussions and meetings are so important. And it's important because we need to come up with a solution, and really, really fast. What we're really trying to balance here is the public health of the nation, vis-a-vis the economic well-being of the nation. And when I say nation, the nation in every respect is some of the people that adds up, that every citizen in Barbados is a nation. So the public health of every citizen versus the economic well-being of every citizen. And I'm not here to talk about vaccine versus unvaccinated. I'm just saying that we need to find a solution that everybody can work with. Why? Because Barbados is one of those countries of the world where we are a tourism-dependent economy. There are many countries who don't have that level of dependency. We have one of the highest. 40% of our economy, in terms of activity, is tourism. 40% roughly of our employment, direct and indirectly, is tourism. Over 50% of the foreign reserves we get from taxi operators that comes from tourism. So when other countries can delay this decision, we can't, because we know any outbreak and pickup in COVID affects tourism and affects the well-being of us. Now this is facts. We don't need to look to anybody for this. In 2020, when COVID hit us, our economy collapsed by almost 18%. We lost $2 billion in economic activity. In perspective, between 2008 and 2017, we didn't really move we grew about 500 million. Losing $2 billion is one of the largest decline in economic history in our country. We usually get about 17,000 people working in hotels and restaurants. We have about 4,000 working. Unemployment went through the roof. That's the facts. In December, we had an outbreak. Then we had to lock down in February. And we saw a 20-somebody% decline in economy. Another 500 million in one quarter we lost. We had a little stability in the second quarter, but because of ashfall, things weren't looking so good. The only way that this economy, the real cost of the economy is here, because it is each one of us can look around and see somebody in our neighborhood, whether it's in our immediate family, our brother, sister, mother, father, uncle, aunt, or somebody next door or in front of us, on the left of us, who lost their job because of COVID, the shutdown, the impact of COVID, who lost their job or even working reduced hours or working part-time because of this COVID impact. Now, collectively, if we don't find a solution that means that we keep the COVID levels down, it means we will not get this economy starting to recover in this year. Everything is poised for recovery right now, by the way, because of the increased commitments that we get, tourism officials working to get increased airlifts, because the other countries, the USA, they got outbreak in Florida. Right now, I'm in Virginia. They got outbreak in Florida, and they ain't feeling nothing in Virginia. But we can't go outbreak in St. Philip and don't feel nothing in St. Michael because we're too small. But this country, USA, is expected to grow by 5.5% this year. Even though Florida got one of the highest outbreaks in the world, we are so small that we don't have that luxury. If we don't get our act in terms of getting another outbreak, we can't manage it. Another shutdown, we can't handle it. We don't have the financial resources. Prior to the COVID, because of the work that being done, we were able to survive COVID in 2020. We were able to provide unemployment and support for the vulnerable and those among us who were affected. We were able to survive. But because of where we are now, we can't afford it again. If our economy was a tank again, all the ratios would go through the roof. The support we're getting from international donors will not have it.
Dr. Greenwich,
Our people who are...
Dr. Greenwich, I'm sorry to cross you, but we're going to have to ask you to close up shortly because we're well past our time and we have to close up this evening. So I apologize for crossing you, but I'm going to have to ask you to close up shortly.
No problem. I just summarize to say that it all comes down, whether you're vaccinated or unvaccinated, we all have to do what we have to do at the individual level to ensure that we protect ourselves and we protect those around us so that we do not get another outbreak so that we can get this country back on track. If you're unvaccinated, you're wearing your mask, you're doing protocols, everybody got to do their part. That's my point. Because what we face is a bigger picture than just whether... The big picture is that we have a lot to lose if we don't get this act together. That's my take on it. That's what I'm going to say for now. Thank you.
Thanks very much, Dr. Greenwich. Thank you for coming in this evening. Dr. Williams, you had one final quick point to make.
Final and quick. I am a proud Barbadian, and I look all around the world and I see what is happening in other countries. Barbados has done very well. We have done well because we have a strong people that survived 400 years of slavery, cholera, disease, starvation, riots, many, many things this country has gone through before. But we have not walked this way before. We have done well because we are a strong people and we have had good governance and strong policy. We have, for the most part, in this pandemic, we have exercised, we have taken our medicine, we have eaten good food, we have followed the social protocols. But most importantly, this is a country of faith. And I believe that God has guided our country this far. We spend a whopping 7% of our GDP on health in Barbados. And I don't want us to be in a position where we are so blessed that we take everything we have for granted. We have a public health system that is free. We have a public care system when you get sick that you can access all the screening, testing, and medication that you need without cost in this country. There are very few countries in the world that can say that. We have vaccines that have been given to us from childhood that are free. We have eradicated things like polio in this country. But most of all, Barbadians, we must learn to take advice. And I'm just going to leave you with one quote from Proverbs 11:14. Where no counsel is, the people fail, but in the multitude of counselors, there is safety. Have a good evening.
Thank you, Dr. Williams. Thank you, Dr. Williams. Rapidly, we're going to go to our vote of thanks, which will be delivered this evening by Mr. Edward Clark.
Once again, good evening, ladies and gentlemen, here at Combermere School in Barbados and on the various social media channels in Barbados, throughout the region, and as far as Australia, as far as I've seen tonight. So, good evening, everybody. I listened very carefully to all the comments here this evening. And I want to thank the government, the Prime Minister and the government of Barbados for allowing the members of the public to give their opinions, their feedback at these town hall sessions to the members of the social partnership, including the labor leaders, the private sector leaders, and members of the government and the cabinet. I think it is an essential part of democracy that we hear all sides of any argument. And I want to thank you for participating this evening in this venture of providing feedback to us on the social partnership. I speak as a member of the social partnership, not just as the chairman of the Barbados Private Sector Association, in saying that we, the members of the social partnership, want to do what is right for Barbados, what is right for the Barbadian people, what is right for our residents, whether or not you are Barbadian, but if you reside in our country. And that is the objective of what we set out to do by these meetings. I believe we have achieved quite a bit. We may not agree on some of the things we have heard. We may all have a chance to disagree and agree on various matters in life. That is a democracy. I want to thank the Acting Prime Minister, Honorable Sandhya Bradshaw, for leading these meetings. It seems that you find yourself in these positions on various occasions, and once again, thank you for doing a very creditable job in this role. I want to thank the Acting PM, Acting AG, Honorable Wilfred Abrahams as well, for attending these meetings and listening to the feedback of our people. I want to thank all the panelists who have participated, not only here this evening, but in general at the various sessions that we have had. I want to sincerely thank the members of the Ministry of Health, the wider membership of the Ministry of Health who have participated in this COVID fight. This is a war, this is not just a battle. And I want to thank you all on behalf of all of Barbados for doing the excellent job that you have done. I want to thank Dr. Corey Ford, especially and the Harrison's Point staff, for the work that they're doing. It's a high-risk job. The reward is seeing people live. And that is the reward that we want everybody to have, life. I also want to thank the Combermere School Board and the staff of the Combermere School for allowing us to use this facility and to participate in such a worthwhile venture. I want to thank all those who helped set it up this evening. I know it was a challenge at times trying to meet what we wanted, but well done to all. I want to thank the people here today, the general public, who have taken time out to come and attend and to give your feedback. You may not all get support, but it's important that you gave your feedback, and we wish to thank you on behalf of the members of the Social Partnership for giving your feedback here today. Those of you in person, and certainly those of you who are on Zoom and the other aspects of other varieties of social media that are participating in this session. Thank you all. I want to thank the press for attending as well. Members of the press who are here, thanks once again. We truly need your support in advocating for safe measures and following of the protocols. And truly, you're doing a job that it is not an easy job. All of you may have your own independent feelings and own personal feelings, but we ask you to be unbiased in all your coverage, and I think you're doing a wonderful job in that regard. Continue to push for safety. I want to thank all the technical experts here. I know producing a show like this in various locations every other day is not easy. And I want to thank Charles and the others on the technical team for doing so. And it is certainly a very worthwhile venture that is being well received by all who are watching and listening to this show. Moderator, Mr. Brian Reese, I have watched you in person. I've listened to you and watched you over the last few occasions on Zoom and otherwise. You've done a really good job, fantastic job, and I want to say thanks. It's not easy controlling an audience like this evening, and the emotions I know take the part, but thank you once again on behalf of the members of this table and the members of the public and the social partnership. So to close, I just urge everyone, mask up, sanitize, stay the distance, and I can only urge and plead with you to get vaccinated. I'm yet to hear a better solution. It may not be perfect, but it's the best option available to all Barbadians at this time. And that is all I'm asking. Do what you think is right, but unless you find a better option, please get vaccinated. Protect your family, protect yourselves, protect the wider Barbados, and stay alive. So thank you, and good night, everyone.
Ladies and gentlemen, I know we're all leaving because we're well past the hour for the closing, but I just want to share with you that any questions that we have received either by Zoom or here in the hall that we were unable to respond to, we are going to be passing them to the Government Information Service, and I understand that the answers or responses or the application of these suggestions will be followed through on. Thank you for coming out, and have a good evening. Be safe.